themselves on mute and we'll begin. Okay, I want to welcome everyone back to the October meeting. And I want to just go over some Zoom etiquette. If you have any TV, radio, other phones, if you're on computer and you have other phones, please make sure these are turned off or away from your computer because everything is picked up during the meeting. If you need to take a call or do something, just make sure you get up and leave your room, but make sure you're on mute.
Let's see. She's hard to hear.
Okay. Today we have a very large audience and we will not be having a formal presentation. What we tried to do between last meeting and this meeting is have people come from the various sectors who can answer specific questions, starting with our own union president, Bob Croghan, who they're all of these people from OSA and from Emblem and from Blue Cross Blue Shield and OLR. They're all have other obligations. So the meeting will be very tight today. We will be starting at 12:30 and ending promptly at 2:30. So please have patience. We will probably not answer everybody's question because there's several hundred people on, but if you stay listening and there will be repetition among the questions. Just know that our media specialist, Rob Spencer, has put a great deal of specific information on the OSA website, including the tape from last month's meeting, the newsletter, and many forms that may be valuable in the situation. So please know that you can go to the website for that. Today, instead of doing a lot of business in the chat, we are urging people to use the chat not at all or minimally because we want to have people raising their hands to be recognized. We have a very small staff who's monitoring all of this, so we want to try to focus on the raised hands. So that would be very helpful if everybody would raise their hand when it comes for the questions and be patient because there are many, many people online. We just want you to know that our team, the board and Rob Spencer, we have put a lot of time between the two meetings to bring you specific information. All of your questions may not be answered today, but I think you're going to be pleased to have more information than you've received before. Just know, as of next month, we will be back to our regular programming on November 10th with a speaker. My colleague, Joan Barovna, will be out facilitating the question and answer. She's worked really, really hard on keeping contact with the people who are coming on today. And like I said, remember, they are very under a time frame here. So we just want to honor that and let everyone who's been asked to come and speak. So we have representatives from Emblem, OLR, Empire Blue Cross, and the union. So with that being said, we'd like to introduce our president from OSARC is Bob Croghan. And Bob, would you take the floor? Thank you.
Hello, brothers and sisters. Good to see you again. And since I'm here primarily to answer questions, I guess I should sit back now and take questions. Ask away.
Well, Bob, you said you were going to update us on some of the questions that were asked at the last meeting regarding the welfare fund.
Oh, sure. Oh, right. Okay. Yeah. There was a question asked about the extent to which we can cover the out-of-pocket expenses. And I indicated back at the last meeting that I wanted to have a meeting with the Management Benefit Fund to find out what they were doing related to superimposed major medical. That meeting is now scheduled as a Zoom meeting on the 18th of this month. So we'll have a better answer after we have a chance to hear that, and I get back and talk to my trustees. In terms of at least one member was calling in asking about whether or not her particular problem would be covered related to some injections that were paid for under the current plan for her knees and so forth and so on. I believe the answer to that was yes, she'll be paid for because it's part of the same, what do they call that thing, pharmacology, same formulary. So that should be okay. In terms of the details about whether or not you're fully allowed to go ahead and continue being covered by groups like TRICARE, we believe the answer is yes. There'd be no problem with that whatsoever because it's going to be an equivalent program. If it's not an equivalent program, there is a problem there. But when we're asking these questions, we keep on running into different people telling us they're not sure and not getting it back to us in writing. So we're trying to get that as fast as we can. We believe that if you were okay before under the old system, you'd be okay under the new system, but we're not positive sure about that. So we have to get the answer on that. We haven't got a good enough answer to give that answer today.
Will you, Bob, will you be posting the answers to those questions on the website?
Yeah, of course. Yes.
Okay.
Okay, so we'll start, anything else, Bob, or we can start with the questions and answers?
You can start with the questions and answers.
Okay, so, Rich Riskin, you have a
Yes,
question?
hi. Good afternoon. I just, the question that I have is, if we were receiving any kind of medication under GHI Senior Care, would we be receiving it under the same medications we would be able to receive under the new plan?
Yeah, that
So
was the goal. That was the goal of the Health Technical Subcommittee, to try to keep things as similar as possible. So without saying with total certainty, because I don't know everything, I'm assuming the answer is going to be yes. Now, they did send me a booklet in the mail talking about their formulary, but honestly, I have not looked up their formulary to double check. But they sent me a booklet in the mail about their formulary, and I assume they sent you the same booklet. So there should be a chance to look at the formulary and see if your particular drugs have any change at all.
Okay, and
Good
now,
Good morning, everybody. This is Diane DeGregorio
And-
with Emblemhealth.
Wait,
Can you
wait,
hear me?
Somebody needs to be muted.
yeah, so let me just interject. It happens to be, we have
And
someone
Bob-
here. We have someone here from Emblemhealth, the drug plan. Her name is Diane. So since, we're gonna have her answer these type of questions after Bob, but she can certainly answer this question. Go ahead, Diane.
Hi, so I apologize. I did get my audio to work, but my video is not working. So it keeps
No
telling me to fail to start video camera. So, but yes, as a current senior care member, you are enrolled in the GHI Enhanced PDP plan. When you enroll in the new Medicare Advantage plan, your prescription drug plan will not change. Everything is going to be exactly the same. You can use your.
Not going to change GHS, not going to change that.
Mr. Isletts, could you mute yourself, please?
You can continue to use your existing prescription drug card. When you go to the pharmacy, you'll be subject to the same copays that you're currently paying now. Now, mind you, every year, January 1st, Medicare changes the out-of-pocket, so the total cost that you pay before you go into catastrophic coverage. So that's the only thing that's changing. Our formularies are updated yearly. The new 2022 formulary is listed on our website. So if there's a particular drug that you're questioning, you can go to our website and you can see if the drug is still listed on the formulary. But as far as prescription drugs, if you're currently enrolled in the plan and you're moving over to the new MA plan, nothing is going to change. The one thing that will change is the cost. Right now, you're paying $150.30 per member per month. As of January 1st, the cost is going down to $125. So that will change. Your cost will go down to $125.
Great, thank you. And Bob, as a follow-up, will the dental plan and optical plan remain the same?
Yeah, I don't see either the dental or the optical being changed. I even foresee that we'll probably continue the same $50 a month subsidy on the drugs. But again, before I open my mouth too certainly, I want to meet with Management Benefit Fund because we try to stay somewhat similar to them, if not perfectly the same, somewhat similar. And I want to hear what they're planning on doing because that's like really interesting things to me. What are they going to do? I don't know.
Okay, thank you.
Okay, thank you. Okay, Eileen Pentel, you had your hand up?
Yes. I'm going to piggyback on about the Part D. My Part D is with my husband's health insurance, which is Empire, United Health. Do I have to take the Emblem one? Or can I keep the one that I have?
Okay,
That's
Does-
question
we-
one.
Representative here from GHI, perhaps they could answer that one.
yep.
Right.
Okay, so this is what the Medicare's rules say, that if you are in a group Medicare Advantage plan and you take a standalone prescription drug plan, it must also be a group Medicare prescription drug plan. So the GHI plan is a group Medicare prescription drug plan, and the Night Shift program is also a Medicare group prescription drug plan.
And so is my husband's. It's from the state.
Right. So as far as Medicare is concerned, yes, you are able to take, you could be on the city Medicare Advantage plan and have this New York State prescription drug plan. But New York State is saying that they're not going to allow it. So we need to get further info, and we're trying to get further clarification from the state of New York if they will allow the members just to have the prescription drug plan. So we have that question out there and we're waiting for confirmation from them. But as far as Medicare is concerned, you can do that. We now need to find out from the state of New York if they're going to allow it.
Okay, and how much, I mean, we pay for Medicare plan, and you're saying we'd have to pay more if we stayed, but how much is this plan going to cost?
So the Part D plan under the GHI City program is $125 per member per month.
I'm talking about the whole Medicare Advantage thing.
The Medicare
I
Advantage
don't
plan
believe
is
it's
not going
not.
to cost you any money. The city is paying for that. That does not cost you any money. It's only the prescription drug piece that you would have to pay for.
I see. And one other question for Bob. Somewhere I heard that there was a lawsuit.
Elaine, before you ask the question, the lady from GHI mentioned that the $125 cost, but the union subsidizes that by $50 per person, so it's actually a $75 cost to you.
Right.
Or to you and your husband, $150.
Yeah, well,
One more-
I don't
just
have to pay anything for that.
Irene, one more question. We must move on to other people.
I understand that somewhere I heard there was a lawsuit against this plan, and I don't know if Bob knows anything.
Yeah, there's a
about
couple of lawsuits. The three, I think there's 3 lawsuits. There's 2 lawsuits by the losing companies saying that they were mishandled in the negotiation process. I'll leave that to the courts. And another lawsuit by some other group entirely saying that the retirees weren't represented, but the retirees were as represented as we always were over all these years by the unions. That's who's been representing us since day one. So I don't think that lawsuit is going anywhere at all.
Thank you.
Okay.
Muting.
So, thank you. So Karen Mangiello? Karen?
Yes, I'm here.
Okay, please ask your question.
Okay. Basically, it is my understanding that if we had any services in the past, we will continue to have those services. It is also my understanding that if we currently have a doctor that accepts Medicare, that doctor will accept the new plan and I don't need to worry about it. Is that all correct?
Mostly correct, but keep in mind that all the time you've been having the prior plan, you've had GHI panel doctors, so to speak. There are doctors out there who maybe don't want to belong to the GHI panel for one reason or another. You'll have more or less the same. In other words, if your doctor was agreeing to it before, my assumption your doctor will agree to it in the future because it's the same company. I can't guarantee every doctor out there, and I don't think anybody else can either, but they're all supposed to accept Medicare, and this is Medicare. And whereas some of the insurance companies out there that are Medicare Advantage are. So they gave a bad name to the program because they're quick to promise but slow to deliver. But one of the things that we really cared about in this negotiation was keeping the same people because we're used to them and we know what their strengths and weaknesses are. And that's what we tried to continue, and that's what we seem to continue.
Okay, I'd like clarification. In the past, I always knew that if I had a Medicare doctor, it didn't matter if they participated in GHI or not. You know, Medicare was the directive. Is that still true, or do I now need to worry whether or not a doctor accepts
Do I?
GHI?
No, more.
Whatever, what it was before, I think it is.
Yeah, leave it up.
I'm
So you know
sorry.
what, I don't mean, this is Joan, I don't mean to, Bob, interrupt, but you know what? At 1:10, Susan, someone from the new insurer will be answering questions, and I think that they can, you know, also address some of these questions.
Yeah,
Okay.
Joan Marlin's on, and I'll be able to address them if you want me to speak to that now or speak to it
Sure,
afterwards.
no, that's fine, great.
Can
So Karen,
the question be answered first?
yeah,
He's gonna
absolutely.
answer your question. This is Marlon. He has popped on a half hour early, which is very nice. And he is from the Alliance, from the new plan, so he will answer your question.
Joan, thank you for the opportunity. And Karen, of course, to answer your question, the plan does have what is called a PPO network. So there's an in-network component and out-of-network component. That means is that you have access to any Medicare participating provider. The good thing about our alliance between Emblem, Empire Blue Cross Blue Shield, and the Blue Cross Blue Shield Association is that we were able to combine all our networks, and that's what made us really strong. Emblem with their strong network of providers within the 13 counties, Empire, on top of that, Empire's network across the state, and then the Blue Cross Blue Shield Association across all 49 states. So, to answer your question, yeah, the contract we have contracted providers. In total, there's about 850,000 Medicare participating providers. Within contracted providers who are also Medicare participating providers, we have 640,000 of those. We also know that 90% of the providers that the retirees see today, they're contracted providers. So in that sense, it was our strength that really moved the needle, because we know the members, we know your providers, and we can continue giving you access to those providers.
I'm not sure if you answered my question. In the past, I only had to worry if my provider accepted Medicare or not. Do I now also need to worry if they accept Emblem or whatever the name is?
You don't, because if they're a Medicare participating provider, right, if they accept Medicare, what happens is, instead of billing CMS where they will get their reimbursement, they now bill the plan, and the plan reimburses them the same rate. So sometimes it's just about educating the provider that they will be paid the same as Medicare would have reimbursed them, which is 100% of the Medicare allowable rate.
So I only need to worry if they accept Medicare or not, right?
Correct.
Okay.
You can call, and if you run into problems, you can call our member services, and what they'll do is we'll contact the provider and work directly with them and let them know how the plan works.
Thank you.
So, thank you. So you know what, there are some other hands raised. I'm gonna go through it, but my, I guess what we'd like to try and zero in on is we only have Bob for 15 more minutes. And then Marlon is available for another, I think, around an hour after that. So I'm gonna just say, go through the people who've raised hands, but let's just try and give the question, ask the question, and Bob will answer if it's geared to him. If it's not, then we'll in 15 minutes, we'll have Marlon answer it, because I just don't want to, we only have Bob for 15 minutes. Susan, your hand is raised. Yeah, Susan, you're on mute. Susan, you're on mute.
Sorry. So thank you for taking my questions. I believe most of them have been answered, but I just kind of need clarification for my own purposes. As far as the prescription plan, if we're currently using Express Scripts to get medication, that will remain the same, if I understand correctly?
As long as your Express Scripts program is with GHI,
Yes,
is it
it
through the
is.
GHI program? Yes, then that will remain the same.
That remains the same, okay. And I know someone asked about the union benefits. As of now, we're still gonna be getting, you know, the benefits of the union as far as dental, and no changes on that. Bob?
Bob?
No? Maybe he left. Okay, and the 125 a month that will come out of our check, because I know the union pays $50 towards our benefits. So does that mean only $75 will come out of the check?
Correct. That's what Bob had said.
Okay, and then lastly, oh, sorry, go ahead.
No, I was just wondering, Rob, is Bob on?
I was muted, unfortunately, but I'm on.
Okay.
Okay,
So,
I'm sorry.
just re-ask your question.
Yeah, right. I was only questioning something you did touch on about as far as union benefits. As of now, our benefits will remain the same from the union as far as dental and vision and.
The dental and eyeglasses aren't changed. Dental and eyeglasses aren't changed at all. The superimposed major medical may be impacted by the additional copay costs. I'm waiting to have a meeting with the management benefits fund to see what they're doing, because we try to stay similar to them. In terms of the other question you asked about the support of the drug program, I assume that will continue, and that's worth the $50 you talked about a month.
Okay. Okay, and then just lastly, I contacted that 833 number when we received the letter from the Office of Labor Relations. So one of the things they stressed that if you wanted to check with your existing doctors, it's very important that we mention that it's not just a Medicare Advantage plan, that it's a Medicare Advantage plan through Blue Cross Blue Shield, and it's a PPO, because many of the Medicare Advantage plans are an HMO, and then, you know, so it's very important you use that language. That's what they told me, that it's a PPO. Just sharing information at this point.
Thank you.
Okay, thank you so
All right,
much.
thank you. Thank you.
Thanks.
Joan Capel? You have your hand raised?
I needed to unmute myself.
Yes.
I'm in the HIP VIP Premier HMO plan, right? And I have $177.59 a month taken from my pension. So am I to understand that if I opt into this?
You muted yourself,
That
Joan.
if, yeah, okay. You muted me?
No, you muted yourself.
I did? Oh, I took my hand away. Okay. I pay $177.59 per month for my pension. So am I to understand if I opt in to this Advantage Plus, that cost will drop to $125 for me as well? Because I know everyone is talking about GHI or senior care, but I'm, you know, in the HIP group. So
Hi, yes, hi, it's Diane again from Emblem.
yes.
So yes, you are correct that if you decide to stay in the new MA program, that you will now be enrolled in the GHI prescription drug program, which will cost you $125 a month. Just note that the co-payments are different. So the way that the HIP VIP plan works is that I believe it's like a $10 copay, $15 copay, depending, 25%, depending upon what the drug is. In the new plan, it's a 25% co-insurance regardless of the drug, whether it's generic brand. The copay is at 25% of the cost of the drug, where in the HIP VIP plan, you have set copays.
Right. Well, at this time, the maximum copay that I have currently for one of my drugs is $10, and all of the other copays are significantly lower than $10. So this new plan will up my copay from $10 for this particular drug that I'm taking.
It could.
Am I
I can't, I
correct?
wouldn't be able to speak to the particular drug,
Yeah,
but it could. It would be so it would be 25% of the cost of the drug compared to the $10 of what you're paying now. So for
Oh.
example, if the cost of the drug was $100, you'd have to
Right.
pay 25%, you'd pay $25 for the cost. Where under the VIP plan, if the cost of the plan was $100, you just pay the $10 copayment.
So that's something to think about.
So,
I mean,
yeah,
that's the
you're
only,
gonna have to,
that's
you would
the
have to
only
look
drug.
into it for yourself.
Yeah, that's
and
the only
see what
drug I
works.
have in that
Yep.
category.
Mhm.
And I also wanted to, but maybe this is for someone else, I wanted to speak to the deductible that is in this Advantage Plus plan. Currently, I don't have a deductible, so will I have to ask that question to someone else?
Hmm?
That could,
Yeah,
you know,
I can answer that.
Yes,
Can answer that
Right.
fairly quickly.
Yes.
So the deductible is $253 for the
Right.
deductible. And those
Right.
are first dollars. So before, let's say you go to the doctor and it's a $300, let's say, payment, you pay the $253 and then the plan kicks in, right? What doesn't apply to that deductible are and it's covered at 100%, would be your like preventative care visits,
Mhm.
your annual visits, your screening, so on and so forth. You don't have to pay, that doesn't count toward, you don't have to pay the deductible. That's covered at 100%.
Okay, so
So
the
anything
deductible,
dealing, like if you're going to a specialist, if you're going to a doctor, you have to meet the deductible first.
okay, so would that deductible be paid with the first visit, or does it come out in increments, or how does that work?
Depends what the cost of what the cost for that visit is,
Right,
right? So it could be depending on the services or doctor that you see, it could, vary. So I wouldn't know for sure. It could be one visit or two visits.
and that cost would be in addition to the $15 copay, is that right?
Yeah,
No.
it will be the first dollars that will come out, the $253 towards the deductible, no $15 copay. Once you meet the deductible, that's when the copays apply.
Okay, so the copay doesn't kick in until you meet the deductible,
Correct.
is that right? Okay, that's the one
Okay.
thing that I was like,
Okay. I
wavering about.
apologize.
Yeah.
These are great questions, but I need to, let's,
Okay, thank you,
so-
great question, thank you.
yeah. So, what I'm really wondering is that, again, we have Bob for 8 minutes. I know sometimes it's hard to know who should be answering what. Are there any questions, specific, to Bob? I have a lot of hands raised, but, he already answered about the dental and vision, and he has to find out about this,
I have a Bob
superimposed-
question.
I have a Bob question also.
Go ahead.
I wanted to, considering the perks that we would get in this new plan, I'm wondering what the savings are to the city.
How do you do it? Oh, that's great.
What-
Please, you didn't tell us last time either.
Can people please mute themselves who are not talking? We hear you and it's very disruptive. Please
Can I
mute
please
yourself.
ask Bob to lean closer into the mic? I'm having trouble hearing him.
Well, I haven't saying very much either, but okay. The perks, the savings, the wonderful deal of Medicare Advantage all came from the private insurance industry convincing Congress back in 2003 and over the years since that this is a far better program because it reduces the amount of paperwork, which it does, and also because it encourages wellness, which it might. I'm not so sure about that part, but they say it does. On that basis, Congress is willing to subsidize the program, and that's where the money comes in. So the fact that the city of New York is planning on not having to pay $600 million a year to pay for our health premiums is all to do with the Medicare Advantage. And it's all extra money being paid by Congress at present for people going into the Medicare Advantage program. Now, there's been a lot of argument back and forth about whether that's a good idea or not a good idea, but that's a question that's going on in Congress, and this is the way they've decided. So right now, New York City is trying to take advantage of it financially, and that's why they can give you the extra money for the hearing aids and the extra money for the silver sneakers and the meals and the transportation. And all this at no cost, and still cost New York City nothing, because the federal government's decided this is a good idea and they're subsidizing it. So it's a little weird, but that apparently is what it is.
May I ask my question now, please?
Is this for Bob?
Yeah, it's a Bob question. I've been waiting to answer it. Thank you. I'm in Florida and I just got on Medicare in May, but with my doctors and specialists and even my internist, I'm told I have deductibles. Since May, I probably laid out over $300 in co-payments. I'm not talking my upfront charge for seeing the doctor. Will this end? How long will I be paying when I go see a specialist? Will I just be paying them $50 and be done? Of course, they do take Medicare, of course, in Florida. Or will I continue to get bills from my cardiologist that's a specialist of $120 a visit?
Hi, this is Diane from Emblem. Are you currently enrolled in the senior care program?
Yes, and Emblem is really not paying anything.
Okay.
They claim they have a deductible with Emblem, they pay pennies, and I'm getting very frustrated with
Okay,
it.
so the way the plan currently works
Mhm.
is Medicare. So because you aged into the plan in May,
Correct.
you're gonna have to meet your deductible.
Correct.
So
What is
Medicare has
deductible?
a
What is
the Medicare has a $203 deductible.
Uh-huh.
Okay, so once you pay, and then GHI has a $50 deductible. So once you pay $253 out of your pocket, you should not be paying any more money. The provider should be sending your bills to Medicare.
They are.
Medicare should be paying 80%. And then from there, the remaining balance should be sent over to Emblem. So GHI will pay the 20%. Now,
But then I'm telling you, they are not paying. I have the bills and the statements I'm getting, and it claims I still have a $50 deductible on every Emblem statement that I get. And I call them and they say, oh, that's a mistake in the computer.
Okay, so two things. One is if it says on the bottom $50 deductible, that's correct. It's incorrect. And if you met your $50 deductible, it should be fine.
Well,
If you do have claims that aren't paid, you can give them to the union and they'll send them over to me and I'll double check them and make sure they're paid.
Well,
So
I
once you
will.
pay-
I'm sending all my bills to the union. I have another bill right now from my internist.
Sir, yeah, okay. I mean, we very much appreciate your
Yep.
frustration. I think
Not a
she's
problem.
given you, an answer, a response, to do. I apologize, we have to. Any other questions for Bob? Okay, Joseph?
I have a,
Joseph,
Oh,
unmute yourself.
mute. Can you hear me? Can you hear me?
Yes.
Okay. My question is, I've read that if you stay in the program, in other words, you don't opt out, you have pre-existing conditions, they continue to cover them. But if you opt out of the program and stay on your old, whatever insurance you have now, that you may have a problem getting into this new program, the Advantage program, later, that they will evaluate you as pre-existing conditions. But can we just talk for a minute about pre-existing conditions? Who changing anything in here? Is that a factor in any of this?
So Joseph, you'll have continuous medical coverage. The pre-existing condition would not apply to you. As long as you have medical coverage, right? So if you opt out of the plan and you decide to stay in the GHI senior care plan, if that's the plan that you're on, you have coverage. So later on, if you decide to go into the New York City Medicare Advantage Plus Plan, you will not be subject to any pre-existing condition because you maintain your medical coverage continuously. So it's
about maintaining coverage. In other words,
correct. Yeah,
coverage straight through a new
straight through with no gaps. With the whole
that they evaluate you. Oh,
yeah. So you'll be fine, Joseph.
Okay.
Yeah.
I'm done.
Okay. I'm sorry.
This is Sharon Cadis. I have a question. My hand's been up. Can you hear me?
Yes.
Okay. I have had a lot of confusion because my husband, I'm currently covered under my husband's Empire plan. I have GHI from the city and Medicare. And with the providers, there's been lots of confusion, and they've been switching the order of who is primary, who's secondary, and who's tertiary. I think part of my question might have been answered regarding the Medicare deductible, which I'm now understanding is $203 for the deductible, and $50 GHI will cover, coming to a total of $253. Am I being put into this new plan automatically, or do I have to elect to be a part of it? And will I be continuing to have the coverage under GHI?
Yeah, so to answer that question, any member, let me just turn on my camera quick. I'm sorry. So any member who is eligible, let's define who's eligible for this plan. If you are a retiree and you're 65 or older,
yes,
or if you are on Medicare because of disability, you are eligible for this plan. Those members will be automatically enrolled into the New York City Medicare Advantage Plus program, effective January 1st, 2022. If you choose or decide to opt out of the New York City Medicare Advantage Plus plan, you have to submit the opt-out form. That will allow you to remain in your current plan. So, Ms. Cadiz, hopefully that answers your question. You will automatically be enrolled into the New York City Medicare Advantage Plus plan. And that plan is managed by the Alliance, Empire Blue Cross Blue Shield, GHI. So we are still your partners with your healthcare.
Okay, and I'm assuming that within a year or possibly two, my husband will no longer be working. He too will be retired. And so that will reduce my coverage or the plans that I'm affiliated with to GHI and Medicare. So between the two of those will still be intact.
What happens under this plan, it's no longer, when you're automatically put into the New York City Medicare Advantage Plus plan, your Medicare now, instead of it being administered by the government, the Centers of Medicare Medicaid Services, your Medicare is now being administered by Empire and Blue Cross Blue Shield, right? So everything, your Part A, which is your hospital coverage, your Part B, which is your medical, everything is under one roof, right? So there is no primary or secondary payer anymore. Just remember that.
Okay, I apologize.
I have a question.
I have a question.
Thank you.
Everyone, please wait. Okay.
Will
So
the
I
union,
have a question.
oh
Excuse
God,
me.
I've been trying to
Excuse
get
me.
talking.
Everyone.
Will you allow me to ask one quick question, please?
Please.
Ms. Milner, there's
Excuse
a
me,
list of
please.
people that Joan is following.
Right.
There's a list of people
Okay.
that Joan is following, and you are not the next person up. So please have a little patience. Mr. Apuzzo is the next person, or Mr. Kozer.
Right. Okay. So I'm Joan. I'm co-chair of OSARC. So first off, I want to thank Bob. I don't know if Bob already left. If not, Bob, thank you. What happened here is, which is absolutely fine, is that we had given Bob was able to be with us for 35 minutes. Answer. Please, everyone must go on mute. You must go on mute. So Bob was able to address the group for a half hour, and obviously in between, during his time, there were questions that were, I guess, more appropriate to be answered by Marlon, who I'll introduce. And so that actually worked out very nicely. People were able to get, already a host of questions answered. So just a quick introduction to this is that, as you can see from the September meeting, we realized there were additional questions, a lot of them specific to the drug plan, which we're hearing a lot of those questions being asked now, issues about opting in, opting out, et cetera, the mechanics of that. So what we did is we invited, with the help of Rob, someone from OLR. I actually do not know if they're
Claire
on.
Levitt is on.
Oh, so we do have Miss
Yes, she's on, I believe.
Levitt.
I'm here.
Hello, Ms. Levitt. Thank you so much. We have Ms. Levitt from OLR. We have Marlon. Marlon, who is the account manager from Empire Blue Cross. We have and he's already answered some questions. We have Diane, who is specific to Emblemhealth, the drug plan, who's also answered some questions. So as you can see, that's been happening is we really wanted to give you this opportunity to ask your questions, but your hands are raised. I see that. I have to follow it in sequence. Okay, please be patient. We have almost 300 people on this Zoom. There are around 20 or 30, around 30, 40 hands raised. I am going through it first come, first serve. Please be patient. Okay, so Marlon, I'm going to just quickly, Marlon is gone. Marlon, say hi. And Marlon.
Hello, everyone. My name is Marlon Pavone, and I'm the account manager for Empire Blue Cross Blue Shield. Again, we, it's an honor to be here today and hopefully be able to answer most of your questions. With the team, like Joan said, we have Diane DiGregorio, part of the Emblem team, and together. And I don't know if we have anybody else. I don't know if Ann Feminella is on the call as well. She's part of the account management team as well. We're here to support you. We're here to help guide you and provide you more information about the plan. I think I was mentioning to Joan before that we understand, changes from the known to unknown may cause anxiety, but hopefully getting a better understanding and information about how the plan works, it will take some of these misconceptions or misinformation about how a Medicare Advantage plan works, specifically the New York City Medicare Advantage Plus Plan, because just remember, this was a customized plan that was designed specifically for the city retirees. No one else in the country. If you aren't a city of New York retiree, you don't have access to this plan. This was designed specifically for you. And we use the power of our alliance, the power of one, which is Emblem and Empire. We came together to be able to continue serving the members because we've been doing this for over 80 years. So Joan, Diane, I don't know if you want to say anything.
No, I guess not. Okay, so what I'm going to do, thank you, Marlon. So what I'm going to do is I'm going to go through the chat, ask the questions. Marlon will take the lead, and if he feels that Diane, Diane can chime in. Ms. Levitt, I don't want to put you on, Ms. Levitt, if it's Office of Labor Relations, should answer the question. So we're going to proceed, but please be patient. Okay, Gerald. Gerald? Gerald? Gerald,
Hello?
you're on mute? Yeah, and I apologize. One of the things that I'd like to ask is that I realize there are a lot of questions, and then but we want to try and get to as many people as possible. So at a certain point, I ask you to streamline your questions and to please not ask a host of questions. We have to get to other people. So I might say to move on, and I apologize for that in advance. That I might have to say we have to move on to other people. All right, go ahead, Gerald.
Okay, currently I live in New Jersey, and at this point, most of my doctors accept Medicare. Previously, you said that over 630,000 participants on Medicare are accepting Medicare. What is to stop these people from opting out of the alliance?
Well, there's 850,000 Medicare participating providers across the country, and out of those, 640,000 are contracted by us. In regards to the contracts, you live in New Jersey, so your access to in-network providers is Horizon. For those who live in New Jersey, you've seen Horizon Blue Cross Blue Shield. In regards to our contracts, nothing is stopping a provider from not being contracted with us. There's another part to this portion as well. Doctors and physicians or providers, they opt in to be part of Medicare, to be a participating provider under Medicare. So with this plan, I want to emphasize is, remember we were talking about a custom plan, and I forgot which young lady mentioned that the PPO is very important. The PPO network benefit that's under the plan allows you to see both contracted providers that are under either Empire, Emblem, or the Blue Cross Blue Shield Association plans across the country. Or if a doctor or provider is not contracted with us, however, accepts Medicare, they can still build the plan and be reimbursed 100% of the Medicare allowable charge.
I understand that, but does the provider still have the possibility to say, sorry, but I'm not going to
if they say, if in the rare occasion that if they say, I do not want to accept the plan, right, and they're not contracted with us, and they say they don't want to, if they're contracted with us, they have to accept the plan. If they're not contracted with us and they're a Medicare participating provider, in those rare occasions, what ends up happening is that the member will pay for the services, the claim, and then they will be reimbursed by the plan. So if you want to continue seeing that doctor and they say they don't want to bill us in those rare occasions, you still have the opportunity to see that provider and you will be reimbursed the same Medicare allowable rate. Important note is that the doctor cannot charge you more than, through Medicare laws, they cannot charge you more than what Medicare is able to charge for services.
Okay, I have one different question, which concerns the fact that my wife turns 65 at the end of this month and will become a Medicare provider. Currently, I'm paying $149.96 towards Medicare Part D prescriptions. Does that mean I now have to pay an additional $149.96 once she becomes Medicare eligible? I mean, I've sent everything to OLR at this point. They've got her Medicare card. In the event she should need medication in December.
So Joe, what I'm hearing is your wife is going to age in to the current plan. So the current plan that members age in for 2021 is that GHI senior care. Come January 1st, your wife will be switched into the New York City Medicare Advantage Plus Plan.
Unless we opt out of it.
The medication, the formulary or the Part D plan is the same is the same plan that is offered through the GHI senior care plan, is the same plan that's going to be offered on the New York City Medicare Advantage Plus Plan. And that you won't be charged additional for it.
You will not be charged additional.
Correct.
Okay.
No, Marlon, just to clarify that answer, to clarify, you're paying so when she ages into the plan, you will be charged an additional premium for your wife. So right now you said you're paying $149.50. You will then be charged an additional $149.50 for your wife. Then when January 1st comes along, you will be paying $150 $125 for yourself and $125 for your wife for a cost of $250. That's not including whatever the union reimburses you. I'm not getting into any of that specifically. It's just you be charged one premium for yourself and another premium for your wife.
Okay.
Oh,
thank you.
Thanks for the clarification. I didn't get it too. I thought that so thank you, Diane. I didn't get that question right.
Yeah, and just to clarify, the rate that was $149.50 for the Part D plan is going down to $125. So the rate for that is actually going down. You will need to pay for your spouse as she ages into the plan, but the rates have gone down.
Great. Okay, thank you. Ralph?
She will have to pay an additional $149.96.
For Medicare. yes, for Medicare, that, what I'm
That would
understanding.
be for that would be for the December premium, and then in January, it'll go down to the 125.
Right.
Okay, thank you.
Thank you. Ralph Demadia? Unmute
Hi,
yourself.
everybody. Can you hear?
Yes.
Okay. I just want to make a brief comment before I ask my question, which I want to direct to Marlon. I want to thank everybody that has put everything together. I thanked Rob Spencer personally through an email last night about the great information he provided in the email he sent to us. And anybody that wants to use their analytical skills can have that information available to them. And I thank everybody of the officers of OSARC as well as the union itself. One of the things I decided to do was follow one of the links he provided us through the OSA website, which is empireblue.com. Okay, I went in there and I actually was able to play around with zip codes, providers, categories, and whatever. And I was able to find that every one of my providers actually participates in the network. Okay, and it said right next to their name, in network. Ditto with hospitals in the New York City area. And I put in every major hospital, both in Queens where I live, as well as in Manhattan. All of them are in the network as far as I can see. So my question to Marlon is, how legitimate is that information on the empireblue.com website that identifies one of my providers or any of them that actually is still a participating member?
It's the most up to date in regards to a directory and based on our contracts with our providers. So I'm happy to hear that all your providers are participating in the network, because it does give a little bit of ease of mind. So like I mentioned before, it's the most up to date. They're contracted providers, and they will continue to be contracted providers as long as they renew their contract with us every year. Every 2 years, I'm sorry.
I think if anybody had the same anxiety and concerns, which I think we share as a group, about, will I be able to see my own specialist? Will I be able to see my own? You have to do this to make your decision. My decision would be to stay with GHI Senior Care, which presents a financial difficulty to me because I'm going to have a whopper increase. Both my wife and I are on the plan. She has no other insurance. I have no other insurance. We have original Medicare and GHI Senior Care. So to stay with that, it's going to be very costly for us. So I had to be reassured that at least I'll be able to see the same doctors I'm seeing. And as far as I could tell from the empireblue.com website, all of them are in there.
Yeah, and that's the best way to it. And if you are not tech savvy and can't go onto the website, just call the 833-325-1190 number, and the reps at the call center will help you look up those providers over the phone. So again, for those who are just on the call, that's a 833-325-1190.
Okay, thank you very much.
Okay, thank you. Alicia Hamill?
Yeah, hi. A couple of questions. One, is there a difference in the new plan for retirees who are in different tiers? Like I'm in one, my spouse maybe in 4, whatever. Is there a difference? Can you hear me?
Yeah, hi,
Can you clarify that? Yeah.
Yeah, there's no difference. There's no difference. The new plan applies to all retirees the same.
Thank you. The other question briefly was coverage of transportation to medical appointments. I'm in Brooklyn. Most of my doctors are in Manhattan. And I am somewhat handicapped in accessibility, getting into the city. How far will they pay for reimbursed transportation?
So under that plan, there's a non-emergency transportation for those who don't know about that benefit. Within the plan, there's 24 single rides that you're eligible for to go see a provider or use them to go to the pharmacy. So again, it's 30 miles is that limit.
Okay, sorry for that. Okay.
So Alicia, you should be covered if you're going from
30 miles. Yep. The other thing is somebody else mentioned the same question regarding HSS, Sloan Kettering, all the major Manhattan hospitals, Mount Sinai, etc. Their question said, basic, or comment said that at this point, those Weill Cornell, Columbia have agreed on a pro tem basis to accept this plan. And is that true? And so then they can opt out at any time?
No, they're currently, most hospitals are Medicare participating. So they're part of the network. The two that stood out were Memorial Sloan Kettering, and I'm happy to announce that we do have a contract with them now.
How long is the contract?
Yeah, and then with the Hospital for Special Surgeries, another one that's out there, they currently have agreed to accept our plan as an out-of-network provider. However, we're working with them now in trying to bring them into the contract. And from my understanding, we're in the final stages, but I don't want to promise that, saying that right now, but I want to say that we're in the midst of it. But the good news is that they can, whoever sees or goes to the hospital special surgeries, they have agreed to accept the New York City Medicare Advantage Plus Plan, or bill us.
Out of plan though.
Yep.
Okay, so I'm gonna move, thank you. I'm gonna move on to the next person. Shirley, I apologize if I'm pronouncing your last name incorrectly, Bonadai, Shirley? And you have to unmute yourself, Shirley. Shirley, you're still muted. Okay, go ahead, Shirley.
I can't talk to you right now. Good afternoon. I am a senior care at Emblemhealth. I was in the process of filling out the Medicare Advantage Plus Op form. After hearing you, I'm a little confused as to where I should go. I'm hearing other people talk about $125, but in this form, when I figured it out, they're telling me about approximately $195. Can you clarify this for me and let me know where I stand?
Sure. So if you opt out there and you want to go into the GHI or remain in the GHI senior care plan, there is a $191.57 charge for the medical component, and then there's a $365 rider that costs $2.83.
Right.
Together is where you get that $194.40.
Mm-hmm.
So for 2022, that is the new premium for the GHI senior care plan. Again, that $194.40 is per member per month. Now, you will automatically be enrolled into the New York City Medicare Advantage Plus Plan, and that is now the new zero premium plan that is covered by the city of New York. So it's your base plan. So if you do nothing and you remain on the plan, it's a zero premium. But if you choose to opt out and go into the GHI senior care plan, you will have a $194.40 per member per month premium that you're going to be charged for.
I'm still a little confused. You're telling me if I didn't fill out this form and I decide to stay where I'm at is a zero, but what type of coverage with my deductions and everything remain the same on my payables?
Yes. So in regards to the benefit, when you compare it to the 2022 GHI senior care plan versus the new plan that's being proposed, the new plan was designed to be modeled after the senior care. So the deductible is the same. The co-pays for the hospitals are the same. And then the difference here where I want everyone to pay attention to now is under the new 2022 GHI senior care plan, there is a co-payment for a primary care physician, which is $15. And there is a co-payment for specialists, which is $15. Under the New York City Medicare Advantage Plus Plan, which is the new plan, which is effective 1/1/2022, it's a $0 copay for the primary care physicians, and it's a $15 copay for specialists. So the difference is if I'm looking at what's going to be coming out of my pocket is for, and I'm comparing the GHI senior care plan to the new plan, is that primary care physician copay. One has a $15 copay and the other one has a $0 copay. So that's important. The other ones, if you're comparing benefits, you're looking at the health advocacy programs that are not included in the GHI senior care, like silver sneakers, like the non-emergency transportation, like healthy meals. I think it was Bob that mentioned, kind of the list of healthy pantry and all the other bells and whistles and features and enhancements that the New York City Medicare Advantage Plus plan gives you.
Okay, all right.
I just, give me one more minute.
Yes, one more question.
197 in additional to what Social Security takes out when the month comes?
Yeah, so that's a good call out. So I think the Medicare Part B reimbursement, that's going to continue because that's a question that we get a lot as well. Will I continue getting my Medicare Part B reimbursement from the city? That will continue. You will continue to get your Medicare Part B reimbursement. But the 197, the 194.40 is only if you opt out of enrolling into the new plan. Remember, that's going to automatically happen. You don't have to do anything. If you want to stay in the New York City Medicare Advantage Plus plan, you will automatically be enrolled. It's only if you want to stay or remain in your current plan.
That I have to fill out this form.
Yeah, you don't have to fill out. You don't have to submit anything, because what that's going to do is you're telling the city, I want to remain in my old plan, but I also am willing to pay the $194.40 to stay in my old plan going forward for 2022.
Okay, thank you very much.
Okay, thank you. So actually, I have a very, very fast question about the copay. So let's say a lot of times a woman gets a mammography and then immediately right after the mammography gets an ultrasound in the same visit. Would there be a copay for each one or just one copay?
It's one copay per office visit. So if you have an ultrasound and mammography done, it's one copayment.
Okay. Would you know, would pre-authorization be needed for ultrasounds? Obviously mammography not, because that's a well visit. But what about, are they needed for certain ultrasounds? Like,
for certain, for ultrasounds, they will need a pre-authorization for it. But typically it's, if under the wellness visit and depending on, your history, the doctor knows best because they're the ones who work with the plan to get pre-authorizations. If it's required, they will submit it for medical necessity to see if it meets medical necessity guidelines.
Okay, thank you. Okay, Constance, Maxie, unmute yourself. Constance?
Okay, yes, good afternoon. I live in Northern Florida and Empire Blue Cross Blue Shield doesn't cover here. And I have Aetna PPO. And what is this new plan compared to Aetna PPO? Is that Marlon?
I think I'm not the expert for Aetna and we don't have Aetna on the call, but what I could encourage you to do is the Office of Labor Relations did a really nice job in comparing different plans, right? So you want to compare your plan to the new plan, you can go onto the Office of Labor Relations, and this website is pretty simple. If you want to have a pen and paper, if somebody can put it in the chat.
Marlon, I posted all of them on our website on the retirees tab.
All right, then perfect. Then it's available there.
It's www.osaunion.org, and then go to the retirees tab, and all of the plan comparisons are there.
Even though Empire Blue Cross and Blue Shield doesn't cover my area?
No, so let's talk about that because we're using also the Blue Cross Blue Shield Association plans. When you're looking up your provider, just like I forgot, I think it was.
Yes, I just did it when he told me. I just did it, and when I put in my zip code, they say they don't cover my area, so I just have to opt out. Then
I would encourage you then to call the 833-325-5555 1190. It should be fairly simple on it. If you go to the website, and I think this is probably on your website, Rob, correct me if I'm wrong, but it's empireblue.com/NYC-MA-plus. That's the website you want to use. And that is pre-populated. So all you have to do then is put your provider's first name and last name. Important note when you're doing your, sorry, somebody's dog is in. Important note, do not put doctor in the search engine in front of the name. It has to be the doctor's first name and last name when you're doing the search. Then also in that provider tool, like you said, you can put the zip code and then you put whatever the specialty that you're looking for, and you'll get pre-populated of whatever doctors specifically for that specialty will pop up, and you'll get a listing. If you're having problems, that's when I encourage you to call the 833-325-1190, and one of the reps will help you.
Okay, so you know what, thank you. Before I get to the next person with the hand raised, I think, Rob, I'm not checking the chat. You saying there's some specific questions about?
Well, there are quite a number. There's a couple of questions in there that I think relate to HIP VIP and the question of drug plans related to HIP VIP and what the co-payments are there. I'm not reading. I just scanned it quickly and I saw that there were some there, and that in this new plan, the moving to co-insurance, if they had specialty drugs, this could lead to a very sharp rise in their out-of-pocket. That was one. I don't know if Marlon has a take on that, or if OLR has a take on that.
Or Diane.
Diane, I will ask Diane to see if she can answer that question.
Could you repeat the question? I apologize.
I'm trying to hunt for the specific question even right now, but there seem to be questions about people who are currently in HIP VIP, and they were asking about one, the availability of getting back to that plan after this year. They were asking also about specialty drugs that they may be currently they're paying a low copayment for, but that they might be confronting a high co-insurance on the new plan, things like that.
Okay, so as far as getting back into the new plan, all members are going to be enrolled into this MA plan unless they opt out. If a member decides that they want to enroll in the new MA plan, yet in June, they say, I really want to go back to the HIP VIP plan, they can use their once in a lifetime and move back into the HIP VIP plan. Or they can wait until the next option transfer period, which would be probably November of 2022, to move back into the HIP VIP plan for January 2023. Now, mind you, members are only able to opt back into the plan they came from. And after January of 2023, their only choice will be the senior care program or the new MA program.
And what about the question on co-payments turning into a rather much larger,
that is correct. I'm trying to pull, if you give me a minute, sure. I'll pull up the exact, the co-payment structure now. But there could be a change, and they could be paying more for the prescription drugs if they go into the enhanced GHI PDP plan. Right now, the HIP VIP plan has a set copay structure for tier 1 and tier 2, which is generic and brand. And then if you give me a minute, I'll pull it up. And sure. Then, so there could be a cost. They would have to determine the cost of the prescription drug, and then they would be responsible for 25% of the cost. So there would be a change.
Yeah, I think the person who was, I desperately searching for the exact post, but they made some reference to the drug costing something like $2,000 a month or something of that, $2,100 a month.
And how much
that was me.
Mm-hmm.
Right now I'm taking Stelara, which is an injectable. When I look at what it costs, it's $2,100, but I'm paying $30, and 25% would be something like $525. And yet I have another option for Part B, but If I can't go to that, your plan is going to cost me lots of.
Okay, so Marlon, that's an injectable, and I don't know if it's covered under the medical or the
Yeah,
pharmacy
so I'm
benefit.
thinking it might be covered by Part B. Is that injectable administered in the office?
I'm able to inject it at home, and then when I go visit the doctors in the office.
Yeah, so we would have to do a little bit more research specifically for that. And I think, if it's covered under Part B, then it's a zero copay. So there's two portions to this. There's Part B drugs that are administered within the office, and there's, some that fall that may be self-administered, but typically those are administered, at a physician's office and under Part B. And then there's your Part D drugs, which is covered through Express Scripts. So in your case, Eileen, we would have to do more research to kind of figure out where that falls.
Can I add one thing to you, Marlon? Just one thing to that. There are drugs that are very high cost specialty drugs that are not in the injectables or chemotherapeutic class. For example, drugs for pulmonary hypertension and so forth, which could be, even in a generic, could be $2,000 a month. So if you were in a situation currently, I believe, if you were an HIP VIP, for example, that would probably, I forget what the copayment is, but it's relatively modest. And if it's a 25% coinsurance, that would certainly be in the realm of, and that's, I don't believe those drugs are Part B drugs. I could be wrong, but I don't think so.
Yeah, I mean, there's also catastrophic caps in the new RX plan that Diane, I don't know if you want to review. I think for 2022, and I think she mentioned it before, CMS parameters for under Part D change every year. And I think this year that cap is at 7,050. And then after that, once you hit that threshold, it goes into a very small copay structure. I don't have it in front of me, but
it's actually 90. The 95% is paid and 5% is your responsibility. And as of now, the union's welfare fund does take care of that 5%. But as Bob mentioned earlier, they're exploring all aspects of the superimposed major medical. So I wouldn't want to promise something.
Right.
So actually, I have a quick question. So you're saying if an injectable, like for instance, Prolia, which many women take for osteoporosis, and that's every 6 months. So, and that's given in the doctor's office, that would
be covered. That would be covered under the Part B benefit, which it's part of the medical. And then at that point, the visit will cost you $15 for the copay for the specialist, but administering wouldn't cost you anything. It's a $0 copay structure.
Is there documentation about this? Will there be documentation about this where people can
Yeah, so there's two things. There's a benefit chart right now currently available on the Office of Labor Relations. And Rob, I don't know if you actually downloaded that as well.
It depends on which one you made.
It's an extensive benefit chart for the New York City Medicare Advantage medical plan. And then there's also what is called the evidence of coverage, which is currently being, it's under final review, and we should have it shortly. Once that's available, that also will be posted on not only the Empire website, but also the Office of Labor Relations website. We will make sure to have that posted for everyone to review, all the benefits.
Okay, great, thank you. Okay, so there's there's a phone number here. I recognize this phone number. Janice, you have your hand raised. And if you can unmute yourself, Janice.
Yes,
okay.
This is Janet. Thank you. I have a couple questions because I have a situation that, I don't know, in Southern Florida, Broward County, under Humana, which is was a New York City contracted plan. And I wanted to know, it's an HMO, Medicare Advantage.
Oh,
Or
I'm
did we
sorry.
lose her?
I might have, yes, and I apologize. I might have pressed something that lost her. I apologize. I hope she'll call back in. Okay, there she is. Okay, go ahead, Janice. Janice?
Is she the one with the 954 number?
Yes, yeah. Oh, Janice, unmute yourself.
It's unfortunate. Maybe go on to the next person, come back. I don't know. I've asked her
Right.
to mute. But...
Okay.
Oh, she
Oh,
unmuted
there she is.
herself.
Go ahead, Janice.
Hello.
Yes, Janice, you're back
Can
in.
you hear me
I might
now?
have, go ahead.
Can you hear me now?
Yes, go ahead.
Oh, okay, because I was cut off for some reason.
Yes, I apologize. Go ahead.
Okay, I'm in Southern Florida, and I have Humana Gold Plus, which is a New York City contracted plan. And what I need to know is that most of what seems to be in the New York City plan, the new one, including the wellness programs and everything else, is offered in Humana Gold Plus. And it also includes Part D, Medicare Part D. I wanted to know whether or not that plan will continue to be contracted with New York City. Hello?
Yeah, so my understanding that it is going to continue being contracted, all plans that are being offered. If you opt out, you will remain on that plan, but you may be subject, and this is important to look up, you may be subject to a premium, going forward. I don't know if they have a premium. I do encourage you to look at the rate chart that is also shared. And Rob, I don't know if you shared that on your website as well, but if you haven't, it's on the Office of Labor Relations website as well.
Yeah, and that is another problem I have. I'm disabled. This is one of the reasons I'm here in Florida. I don't have internet. And I wanted to know if there's someone that I can actually speak to in Office of Labor Relations. The number that I call, or health and even health benefits, the numbers that have been provided, no one answers. And I'm just at a loss.
Yeah, Janice doesn't have a computer. She doesn't have internet, so she's in
reference to the opt-out form, I need an explanation, a clarification of something. And the person asked for my date of birth, et cetera. I thought they were not supposed to ask for personal information.
So they will do it over the phone. So that's a good point right here. I think in order to be able to process the opt-out form and to have it be identified in the city system, we have to ask those particular details. And what's going to happen is that they are putting it, as they're taking that information, into a secured website, and then they get a confirmation for that opt-out. And what you will receive following that is a confirmation letter.
Wait. Is this after I submit it, or just to ask a question?
No, so there's several ways to submit an opt-out form. One, you can call it into that 833, right?
Oh, well, that's not what I was doing. I just asked for a clarification.
Okay.
And I had been told by previous reps that the personal identifying information, they weren't supposed to take it. It was none required.
That they
I
probably
can-
thought you were submitting the opt-out over the phone and started going through their, asking you that information. So I apologize if they misunderstood.
Perhaps I can clarify. If somebody is calling you and asking for your personal information, don't give it. But if you call a number that is legitimate because you are doing the calling, then they are verifying. That's a very different situation. I think that's your question.
Right.
Okay.
Okay. All right.
Thank you both. I appreciate your information.
Great.
Oh, so in other words, the Humana plan should continue even if, like you said, maybe subject to a premium.
Correct.
Okay.
Right,
And
and I have,
then
and Ms. Levitt has agreed to, she says she'll talk to you, that you can call her, okay?
Yeah, thanks a
Okay.
lot. Appreciate it.
Sure. Walter Clark? And unmute yourself, Walter? Walter?
Yes, I'm sorry.
That's okay.
When I'll call you right back. I have a quick question. I'm planning on moving to Georgia, and I presently have, I don't know what you call it. Here, I'm gonna show you the card. Is this considered, what's that, HIP VIP?
I believe that's the HIP VIP
Yeah,
card.
that is correct.
Okay, it's, yeah, because it says HIP, it says Emblem Gold.
Right. So if you're moving to Georgia, you are going to need to come out of the HIP VIP plan because we do not have a service area there.
Okay, so with this new plan, and I say this because I'm a disability retired, so I am receiving, even though I'm only 60, I'm receiving Medicare.
Mhm.
I am a double lung transplant patient. So my doctor says that she's going to transfer my records to Atlanta to a hospital. I forget the name of the hospital, but it's a transplant hospital. Emory Hospital in Atlanta. So my question is this: what plan do I need, or is this new plan that you guys are going to make us go into covered? Will that be covered over at Emory Hospital in Georgia?
Yeah, I would verify. I would say yes, that it's covered, but I would double check always, right? Like we've done with a lot of the members to see if it's in network. But even if if the hospital is an out of network Medicare participating provider, you should be able to see them in regards to access, right? So that plan and the New York City Medicare Advantage Plan, remember, it's a PPO and it's a national plan, so you have coverage through all 50 states.
Okay, so what secondary plan besides this should I have, or should I try to?
There is no secondary. I mean, that plan covers, there's no secondary payer. There's no primary payer. It's a Medicare Advantage plan. So all you need is that one card, and it covers your medical and your hospital benefits.
This card no longer exists.
So what I would suggest is, when are you moving to Georgia?
Probably somewhere around January.
Okay, so when you're moving, I would suggest that you contact OLR directly. You would need to complete a form. And at that time, your option would be either to go into the new, okay, hold on. Let me hold off a second. So right now, are you planning on staying in the HIP VIP plan, or are you going to go into the new MA plan?
I'm going to go into the new plan. You guys are.
Okay, so if you go into the new plan, as of January 1st, you're going to be in the new plan and you will be covered in Georgia. So there's nothing for you to do. You would just need to change your address with OLR.
Okay, got it. So this
Okay.
difference.
Right,
Okay.
so as of January 1st, that card will no longer be good and you'll be in the new plan and you should be fine.
Thank you.
You're welcome.
Okay, great. We have like around 20 or so, 25 more minutes. There are 15 people hands are up, so I'd like to just calling on, let's move quickly. I think, this is really, people are getting, answers to the questions, which is great. I mean, this is terrific. Mary Keating, unmute yourself, please. Mary? Mary?
Hello? Hello?
Hello. Yes, Mary, go ahead.
Okay, I live in Miami. Surprised by some of the information I'm hearing, because I was told that the only plan I could use would be GHI. Because everybody else had no.
Bob, if you can mute Lorraine Alexander.
Yeah, I'm looking for
Hello? Can you hear me? Hello?
Yeah, we hear you. Hold on a minute, though. I'm looking for Lorraine Alexander. There you go.
I'm getting a lot of different voices.
It's Lorraine Alexander who needs to be muted, and I keep trying to mute her, and
Okay.
it doesn't mute.
Okay. All right, let me try again. I live in Miami. I was told that the only plan I could participate in was GHI because I originally had Aetna and they had nobody down here. They had nothing, no coverage, no network. GHI told me that because they also had nobody down here, that my visits would be considered in network. But every bill I see or every record indicates that whatever service I've been having has been out of network. That's fine.
Are you under 65? Are you not Medicare eligible?
No, I'm 77. But my issue now is this. Obviously, I don't know what I'm paying, if anything, now for GHI. I'm having a great deal of difficulty keeping up with all the paperwork. However, I would probably try to pay the new large monthly $194 a month to stay with GHI because I'm very fearful. I've just had a heart diagnosis. The tests are still going on. My doctors were able to move very, very quickly because I did not have any pre-authorizations. I would not want to join the Medicare Advantage Plan because it sounds like you need a lot of pre-authorization, and the last thing I need is more paperwork. So can somebody address this pre-authorization question? Because to me, it's a make or break thing. I just cannot at this point in my life. I live alone. I don't have family. I don't have anyone to really help me with the paperwork. So I think I need to stay. So far, I have not had to have any pre-authorizations, and I've had, and I'm still having, I'm scheduled Friday for probably a chemical stress test rather than a treadmill stress test, but I've had my thyroid. I just had an ultrasound of my thyroid. I quickly had EKGs, echocardiogram, and chest x-rays because my doctors were able to move quickly and there was none of that nonsense about pre-authorizations. So somebody just tell me, do I need pre-authorizations for these kinds of?
Mary, this is Claire Levitt from OLR.
Yeah.
Yes, there are some procedures that will require pre-authorization under the Medicare Advantage Plan, but there is no additional paperwork for you. The pre-authorization takes place between the doctor and Empire. This is not a paperwork burden for you. You should be able to get all of the medically necessary procedures approved. There should be no problem with it. We've really, I know there's a lot of misinformation around people thinking that pre-authorization is going to mean that there will be a lot of denials of procedures and won't be able to get care quickly. And that's just not the case. There are regulations that from CMS, from the state government that monitor what happens in pre-authorization, and it really shouldn't delay you.
All right, so my pre-authorizations basically then I gather should be from Blue Cross Blue Shield because nobody else has any networks down here, right? Does Blue Cross Blue Shield have a network of doctors? I do not want to change my doctors.
This is a national program, so there are doctors all over the country. As Marlon said earlier, 850,000 Medicare participating providers, and 640,000 of them are actually in the Alliance network. And where are you located?
I'm located in Miami. Most of my doctors are from the University of Miami Medical Hospital or Baptist Hospital down here.
Yeah, as Marlon said, you really should check. You really should check that and make sure that your doctors are in network, just for your own reassurance. Even if they are not in network, if they accept Medicare, they will be getting the same payment from the Alliance that they get from Medicare. So there's no reason for them not to take the payment.
Okay.
I
I will check that. I will check that.
Okay, one more question, please, and then we must move on. We have some other people waiting.
Thank you.
Anything else?
No, thank you.
Thank you. Okay, Jay, unmute yourself. Jay.
Good afternoon, everybody. I'd like to make an issue about the guarantee that Sloan Kettering will take the plan. As of this morning, I was in the Comro meeting, and plaintiffs to the lawsuit were on at the meeting, and their statement was Sloan Kettering has only guaranteed to stay in the plan for 1 year. That's issue number one. Now, this is being recorded. Marlon, I guess you're on the hook for this. In the second year, we'll be going to you directly. Number two, this entire boondoggle by the government to privatize Medicare only will last for 5 years. After 5 years, what happens if the city can't absorb the cost or the state can't absorb the cost? We have absolutely no guarantees whatsoever. And I'll tee off and anybody can try to answer that. Thank you.
Marlon, can you comment on the Memorial Sloan Kettering?
Yeah, in regards, I mean, this is just contracts that we have with the providers, and they get re-credentialed or they become continue being part of the contract, and that happens today with all our providers. So as of today, I think one of the biggest things that we're hearing is that Memorial Sloan Kettering was not contracted with this plan. So we went proactively and negotiated with them, and we were able to get a contract so that they're in the network. However, previously, even prior to that, Memorial Sloan Kettering, since they're a Medicare participating provider, we're billing the plan as an out-of-network provider. So in that regards, if something were to happen, Jay, they will continue submitting their claims or accepting the plans as out-of-network provider, as long as we're reimbursing them, the Medicare allowable rate, which is the case, and we're obligated to do that as a contracted health plan with the Centers of Medicare and Medicaid Services. So, Claire, if you want to take the second part.
I'm not sure where you got the information about Medicare Advantage only being available for 5 years. Medicare Advantage plans have been around since 1997. And as far as we know, there's no indication that they are going to end.
It's my understanding the federal legislation expires after 5 years.
It probably gets renewed every 5 years, but it has been renewed routinely since 1997.
And New York City only opted into Medicare in the 1960s when we first got in. I'd like to make well, let's drop that. One other small issue.
Our intention is to, remain in the Medicare Advantage plan, assuming that it is successful and provides appropriate benefits for everyone. Our contract with the Alliance is for 5 years, but also gives us an option to renew at the end of 5 years. We still have an obligation the city would still have an obligation to provide a premium-free plan for retirees. So should something happen with Medicare Advantage or with this plan, the obligation still exists for us to provide a premium-free plan.
Well, Claire, I would point out that the state constitution provides that our pension, well, it provides that our retiree benefits can never be diminished, but several legal actions have interpreted that only to mean our pension coverage. I believe one of the terms of the lawsuit that's currently being filed by this retiree group, the New York City Association of Retirees, whatever it's called, one of their premises is that the city has always provided free coverage. Therefore, they're obligated by custom and practice to continue providing free coverage. And if in fact the Medicare subsidy expires after 5 years by the feds, the cost is supposedly going to be borne by the 50 states. And we don't know what's going to happen then.
So I'm sure you understand that I can't comment on the ongoing litigation.
Just point of information, just so everybody's got the cards on the table. I believe we're all frogs in the warm water being boiled.
But
all right.
Joan, move on. That's okay. Thank
But
you.
yes, let's move on. Point made. I'm going to call some. Claire, do me a favor and check the chat. There's a question from me. Okay. Thank you. Just answer specifically to me in the chat. Joan Crystal.
Thank you. To build on Jay's question, but not nearly to that extent, I currently have the Aetna Medicare Advantage plan. I understand if I opt out of the proposed plan, that I can stay in Aetna at least through the following year, 2022. But is the intent to continue other plans beyond that year?
Yes. If you opt into one of the other plans, you will be able to stay in that plan beyond this year.
And just as part of that question, if the number of participants in that plan decreases as a result of this offering, would I expect the plan that I'm currently in to be decreased in terms of what it's able to offer based upon a reduced number of enrollees?
I don't think we can speak for what the other plans will do. It's certainly possible that they, based on having reduced volume, they could change their pricing or change their benefits. I don't think we can speak to that at this time. Certainly, it's not our intent to discontinue them. They could potentially discontinue with us, but then you would always have the option to go into either the senior care plan or the Medicare Advantage plan.
Okay. I'm going to move on because Marlene, Claire, Diane, how long can you stay on? Can you stay on 2:15, 2:30? I mean, we are.
I'll stay on as long as we have questions.
Okay, that's very nice of you. Thank you. Okay, Mark, go ahead. Unmute yourself.
Mark Lewis.
Mark.
I'm trying to, okay. I'm unmuted now?
Yes.
Yeah.
Okay. Currently, I had opted out of all the plans a number of years ago because I'm covered under my wife's state plan. And I'm trying to understand, you said something about being able to keep the drug benefits in the state if I go to your plan. I haven't received anything in the mail since I had opted out a number of years ago. I've not received anything. what is the status of my being able to keep the drug plan that my wife has? And would I be able to opt back into the state plan if I'm unhappy with the city plan?
So Diane, could you clarify? I think the question was, I think we're still trying to get additional information in regards to the New York State RX plan, because you can only have the marriage works between a group Medicare Advantage plan and a group Part D plan. But what we've recently have been advised is that New York State is saying that the members are not eligible for the plan if they go into the New York City Medicare Advantage Plus plan. So we're trying to get some clarification from our end. Diane, do you have anything else to add to that?
No, I don't, unfortunately. Like you said, Medicare rules should allow it, but New York State is telling us something different.
Because the drug plan is a lot cheaper with the state than this 25% thing that where we have to pay 25% of drugs. Because my wife gets certain injectables that she does herself, and the cost is would be significantly higher.
Yeah, so what we'll do is, as soon as we are provided with some clarification on how the state wants to handle this, we will make sure that we disseminate that information to all the unions, and it would be on the Office of Labor Relations. And most likely, Claire would probably add that on the frequently asked questions. Because it has popped up a couple of times, and we're trying to get clarification from the state now.
Yeah, but I'm not getting anything from OLR since I had opted out a number of years ago. They've sent me nothing.
So the mailing was sent out based on members currently being enrolled in one of the health benefit programs. So that's probably why you did not receive it, because you've chose to opt out of the plan.
Yeah, we understand that, but at that time, it was a lot cheaper for us to be under a family plan with the state versus the city, especially because of the drugs.
Mm-hmm.
So
Mark, I think all the information is that you would need, correct me if I'm wrong, Claire, is on the OLR site.
It is the enrollment guide. The enrollment guide is on the OLR site. All the rate sheets and plan comparisons are on the OLR site. And if you have additional questions, you can call the Alliance call center number. They will have access to the network doctors and all the other material.
All right. Can I also call you if I don't feel I have the answers?
If you feel you're not getting the answers, you can call me, but I don't have access to like the network doctors and all of the details. So you really are going to get the best information from calling the Alliance call center.
Okay, thank you.
And Joan and Rob, this is something also that you can help Mark with, right? I believe a lot of the retirees that fall can always call the benefit administration's office, correct? And I'm assuming that a lot of these questions are popping up, and we're there for you to Mark to support you. The call center will be there. In regards to that information, it is available on the OLR site for those. I think Rob had mentioned that it's on on your website as well. But for those who want to note this down, it's for the OLR site, it's nyc.gov/H as in Harry, B as in Bob, and P as in Peter. And then all you have to do is click on the retiree tab and all the information will pop up.
Okay, thank you. Margie, unmute yourself.
Yeah, hi. You got me?
Yeah, go ahead.
Okay, just quick questions. First of all, in terms of OLR, are the IRMA benefits still in effect under this new plan besides the They are. Okay. Next question. If I were to go to an urgent care center, how does that work? Are they billed according to individual doctors, or are there individual urgent care places that have contracts with you, or how does that work?
If you look up under Find Care or any urgent center, it's a $15 copay. That's basically it. So any of
that
the
would,
yeah.
so that would take care of that. Okay, one other quick question. In reading through the information, I was not clear, I'm not there, but about hospice care. And it looked like there was a distinction between regular Medicare and the Advantage plan. Can you clarify that?
Yeah, so in those situations, our team, our case managers will help transition into a hospice care services. But hospice care is actually covered through traditional Medicare.
That's what I thought, yeah. So then would you have to go back to traditional Medicare? If that happened, would you use your one-time a change that,
It would be then covered through traditional Medicare. So you'll get the Medicare come in and cover all the services and claims under the hospice care.
So it wouldn't require any changes or anything, it would just be an automatic.
Correct. It wouldn't require any changes at that time.
And one very quick question, is yes, okay. Is your marketing making it clear to all the people who many of us deal with that this is actually happening? Because I know some doctors and some people don't seem to be aware of it yet. I understand it's relatively early in the process, but.
So Margie, I'm glad you brought that up, because since this was a customized plan for the city of New York, it also had a customized name to it, which is now the New York City Medicare Advantage Plus Plan. So there's, in regards to raising awareness, a lot of the front office staff, they don't know. So when retirees call their providers, they're going to say, I don't know what you're talking about, right?
Right.
But having said that, there is a comprehensive provider communication strategy that has been launched since July. So we've been sending out newsletters in July and August. We've been doing email blasts. We've been putting on provider portals. And then we're also going to be doing phone calls. So, and we're actually also doing webinars to kind of teach them through, how the plan works, and to advise them that this is, if you're contracted with Medicare PPO plan, you're already contracted with us. So it's about raising awareness. I think where some of the confusion was, as we customized this plan, the actual name of the plan needs to be disseminated across all the providers. So we are calling every provider, and we're doing that before the effective date. So, and if we don't get them the first time, we'll get them on a second queue or third queue. We're doing multiple outreaches to make sure that we talk to them.
So they would essentially submit, I don't know what they do, but they would essentially submit the same whatever forms or electronically, but it'll be to a new address, or you will migrate from one to the other just as a normal process?
Yeah, so if they're contracted providers, they'll use the same systems that they do now, submit the claims or services that they do. If it's an out-of-network provider that is not contracted with us, and it's a Medicare participating provider, what they do is to submit a claim form directly to our plan. And that's something that we as a plan would educate that provider on how to do it, right?
Thank you.
Thank you. Dolly Adams, unmute yourself.
Okay, can you hear me?
Yep, go ahead.
Okay. All right. Currently I have VIP Premier, and I pay $177 a month. And for prescriptions, it's usually $5 or $10, depends upon whatever the prescription is. Okay. So now if I stay with VIP Premier, I want to make sure that I will not be charged an additional $194. Is that correct? I'll just pay my regular.
So HipVip plan is one of those, it's one of the plans that's actually also remaining as zero premium. So under medical, And then
and
but that charge is for the Part D portion of it, right? So that's 177.50.
177.59, something
Yeah.
like that.
And
Yeah.
and Diane, is that right? Is that accurate?
Yeah, so the prescription drug portion of the HIP VIP plan is correct. It's 177.59, and that rate will not change for 2022.
Okay.
And I was able to locate the current coverage levels. So for preferred generic, you pay a $10 copay. For preferred brand, there is a $15 copay. Non-preferred drugs is a $100 copay. And for specialty drugs, it is 25% of the cost.
Okay. All right. Now, my other question is, if I go with the New York City Medicare Advantage, right? Will I keep and they'll charge me $125 for the prescription part of it, right?
Correct.
So I will just be rolled over. I don't have to contact OLR and submit an ERB form to.
Correct. So if you're currently enrolled in a prescription, if you currently have HIP VIP and you're enrolled in the prescription drug plan, when you transfer over to the new plan, if you have the optional rider, you will continue to have the optional rider. They will enroll you into the GHI enhanced prescription drug plan.
Okay, so I don't have to do anything then.
Correct.
Okay, great.
Okay.
Thank you.
Thank you. Jeannie O'Sullivan, and unmute yourself. Jeannie?
By the way, John, I think you missed Joseph Apuzzo.
Well, but you know what, but Joseph did ask a question before.
I'm sorry, I
He asked a question
apologize.
before, so I want, Joseph, I'm sorry, I want to,
No,
get to.
no explanation needed. I apologize.
Right. Jeannie O'Sullivan?
Yes, thank you. Follow-up hospice question. I've received two opposite answers on this from calling the concierge. So for someone who's in hospice now, I received one answer that you have to stay in traditional Medicare because traditional Medicare pays for this. And then another person told me we could go to Medicare Advantage, and Medicare Advantage would just bill traditional Medicare. So what would be the recommendation on this?
Trying to think through the scenario here. So you're going through hospice care and you're
This person
yeah.
just went on to hospice last week, family member, and we were told, you can't go into the Medicare Advantage because this has to be covered by the original Medicare. But then I called back and they said, no, you can go to Medicare Advantage, no issue, and they would just bill original Medicare.
Yeah, so if it's through hospice, they will, I don't know if they will bill original. So when they say bill, the provider will bill traditional Medicare. And I was trying to see where that distinction was, right? So the provider will bill traditional Medicare, and then any other services rendered that may fall into, depending what the situation is, right, would be covered by the Medicare Advantage plan. So any services that fall under hospice care, the provider would then bill traditional Medicare. So that hopefully that helps clarify your question.
It doesn't. Can this person go into the Medicare Advantage?
They can go into the Medicare Advantage, and what is going to happen is that the provider for the hospice care services is going to bill traditional Medicare, because that's what that part of the benefit allows. And it's also stipulated, if you go into the benefit chart or benefit summary, you're going to see that it states that in writing.
Will there be any cessation of services in this change that goes January 1st? Because we would not want that.
No, I think the provider is going to be, there's a transition of care, right? So the provider is going to be involved. So there's not going to be any cessation of services.
All right. So they could just go into the Medicare Advantage, just with everybody else.
Correct.
Okay, thank you.
All right, Deborah. Deborah, unmute yourself. And actually, again, and Marlon, how much longer can you stay on?
I can stay as long as you need me to.
It's
That's
Diane.
very-
I'm gonna have to hang up in the next couple of minutes. I apologize.
That's okay. Go ahead.
Good afternoon. My question, I have a few questions. One is, how often are the listings of providers updated?
It's automatic. It stays. It's so the best way to kind of look at the most up-to-date listing, I think we had this question before, is to go on the website that was provided, which is at empireblue.com/NYC-MA-plus, and that's the most updated provider listing.
Okay, the reason why I ask, because prior experiences with Advantage plans, I found that the listing of providers wasn't really current, and that was discouraging because I'd go and I'd look and most of the people who were listed were not active participants. So that's why.
Yeah, we have a team dedicated to making sure that they refresh and keep that up to date. That as a plan, we want to make sure, that's the most critical point. So we spend and invest a lot of our time to make sure that those up to date. So if you go onto the website, like I mentioned before, that's probably your best bet. It's going to be updated.
Okay.
Any,
Can I ask another?
Yes, one more, please. And then.
Okay, did I hear someone say that after effective 2023, that the only options that will be available are either the senior care or the Advantage or this Alliance plan?
Correct. For those aging in into past that date, the only two options that are going to be available are the senior care GHI and the New York City Medicare Advantage Plus Plan. If you're currently enrolled into and you opt out, you can maintain that plan through the life of whatever the carrier chooses to do, because they may discontinue the plan. I think we mentioned that as well. It was a question that was asked to Claire. So currently right now you have the option to go into, let's say if you were in a HIP VIP or an Aetna plan or UHC, we also heard somebody who was on Humana. If you opt out, you have the ability to stay in that plan, but you also may be, exposed to some premium costs. So that's one thing that you have to be aware of. And then every year, the carrier may, change the premium, may bring the premium up or change the benefits. So that's another thing that you may want to also consider. Under the New York City Medicare Advantage Plus Plan, for the life of this contract, there aren't going to be any changes. We can't change the benefits. We're in contract unless Medicare adds an additional benefit, and then we would have to honor Medicare's change. But a lot of times those are enhancements that Medicare provides.
I have a couple of questions for Diane before she leaves.
Oh, well,
wait, who's that?
Wait. Who was that?
Me, David.
Well, I still had one more question, and this relates to
you know what? One more question, and I apologize. We have to follow the sequence, okay?
Okay, this is and thank you, Marlon.
Please make this quick.
Quick question, am I correct to understand that no matter the medication, you have, I would have to pay 25%?
Yeah,
cost?
Diane, can
Yes.
you answer that?
Yes, that is correct.
Yes.
Yeah. The way that this
Okay.
plan is, the way that the prescription plan, there's 4 tiers under the plan. You have your generics, your preferred, non-preferred, and then specialty. That plan works 25% across. So whatever the cost of the plan is, the member's responsibility is 25% of it. So if it's $100, you're responsible for $25, just as an example.
Okay, thank you. Okay, let's move on to Ellen Birch. Ellen, unmute yourself.
Hi, I just have, they're saying that that the plan pays the same as Medicare. And right now, when we submit to Medicare, GHI picks up the 20%. What's gonna happen? What happens with that 20% now?
So everything is rolled under one roof. Under traditional Medicare, Medicare pays 80%, they're the primary payer.
Right.
And then the supplemental plan, in this case, is the senior care plan, picks up to 20%.
Right.
Under Medicare Advantage plan, under the Medicare Advantage plan, that goes out the window. We are the only payers. And the only thing that the member is responsible for is their cost share, whether it's a copay, whether it's the deductible, so on and so forth.
Okay. All right, so therefore the doctors may not be benefiting by getting the extra 20%. We'll be paying either a copay or it's going toward the deductible.
Yeah, so just think about the services. If a service is under the old plan, it's we'll do $100, right?
Right.
Medicare will pay 80, and then so the provider bills the government the $80, and then they bill the $20 to either let's say GHI.
Right.
Under this case, they still get the $100 minus the copay if there is one.
Oh, okay, so it's all the same.
Right.
The other question I have, my husband and I, we're two seniors and we have a 29-year-old son who's disabled. He has MS. Are there any changes to his benefits? I know this has nothing to do with our plan.
Is your child Medicare eligible under disability?
I don't know. Right now he's not on Medicare at all. He's under our plan.
So if your child's not Medicare eligible, then what happens is you will enroll into the New York City Medicare Advantage Plus Plan, and all dependents who are under 65, they get mapped to the GHI CBP plan.
Okay, so would that wouldn't change.
Yeah,
now, but change. What would, if we have no premium, what would be his premium for him?
I believe, Clara, can you?
No premium.
No premium, zero premium. That's what I
no
thought.
Premium.
Yep.
But we would pay for the drug rider, correct?
Correct.
And the drug rider is how much?
Correct.
Right. Okay.
What is the drug rider?
125.
125 a month.
Okay, that's all.
No, 125 is for the New York City Medicare Advantage retiree.
Drug rider.
Yeah, I don't know what's the CBP drug rider for.
Oh, the CBP. So when you have a member, if you have more than 2 people on the plan, OLR will not charge you, the city will not charge you any more than a family plan rate. So I believe it would just be $250. I have to double check the chart, but if you look at the chart, I think it's just the $250. Claire, is that correct?
You know, this is an unusual situation because you've got two retirees, and then I think that the dependent is not going to be under the Medicare Advantage plan. They're going to be under the Actives plan. So I'm not entirely sure. So maybe we can get back to you on that.
I know it's no more than the family rate. So I don't know if it's the family rate on the CBP portion or if it's the family rate on the Medicare portion. So we'd have to get back to them on that.
Okay.
Okay, so Joan, it's Diane. I do have to hang up, but I know that David Chester wanted to ask a question. So can we go to him?
Sure, of course. Go ahead.
Yeah, hi, thanks. I have a couple of questions about Express Scripts, because if we take Medicare Advantage, then we have to take Express Scripts for the drug plan. First of all, is there any way for somebody who's not already a member to look at the cost of individual drugs? Is there a website, a web page that we can go to?
I need to get back to you on that as far as the cost. I think you could call our customer service department and they would be able to give you.
There's a problem. I've tried that and they won't deal with you unless you're already a member.
Oh, geez. Okay.
They want a membership, you know. All right, the other question is, if I decide to also keep Medicare Advantage, I'm sorry, if I decide to drop the Medicare Advantage and opt out and keep senior care, how do I drop the Express Scripts part if I want to?
So what, can I just ask you, what plan are you currently enrolled in?
The senior, GHI senior care.
So you currently
I
have
don't have
senior care
Express
with,
Scripts.
with
I don't
no
have
optional
Express
rider.
Scripts. I'm sorry?
You don't have the optional rider currently?
No, and I probably don't want it.
Okay, are you currently on a different
Yes.
prescription drug plan?
I'm on Aetna Silver Scripts, which I think I probably want to keep.
Okay, is that a direct pay plan or is that a group plan?
No, it's direct pay. I
Okay,
guess.
so if you go into the new Medicare Advantage plan, you're not going to be able to
I
keep
know.
the direct
But
pay.
I'm saying if I decide to opt out and
If you decide to opt
stay with
out,
senior care.
and OLR currently has you with just the base plan with no prescription drugs, you will remain there. There's nothing that you need to do. If you want to elect to pick up the rider, then you would have to complete an application.
All right, but the first thing about getting the drug prices, can I send you an email or you send me an email, or how can I get the information?
Could you go through the union, Joan? Would you be able to get that over to me and just get us, and then I'll see what I can find.
Okay, so you know what, give me, I apologize because I'm like lowering hands. What's your name? The person asking the questions?
Yeah, my name is David Chester. I could give you my email right now if you want. I don't care.
Okay, go ahead.
All right, DAC10012@gmail.com.
Okay, got it.
All right, and then the last question, this is, I don't know if this might be actually for the group. You guys were saying, or actually Diane said it, something about you after 2023, you won't be able to change from one plan to another. Is that correct?
After 2023, you have the option of staying in the Medicare Advantage plan, or you can switch to the senior care program. Those will be the only two plans that you could.
Right, so you couldn't go into Aetna or Empire or any of the other plans?
Correct, but Claire, do you want to clarify that?
Yeah, that's correct. If you stay in one of those plans, Aetna or Humana, now you can continue to stay in those plans now. But if you moved out of those plans into Medicare Advantage or senior care, then you won't have the option to go back into that plan after 2023.
I understand that. Okay, which is not great. But what about the changeover in 2022? Will we have the opportunity to go into any plan then?
No, you have the option to either go into senior care or the Medicare Advantage plan, or stay in your current plan.
So it's not just 2023, it's next year too. So in other words, from going
Claire?
forward, we can't change to any other plans except the one we're in or Medicare Advantage. Is that what it is?
That's correct.
Wow, not great. Okay, anyway, thanks for telling me. And Claire, thank you very much for sharing your phone number. And the reason why I'm telling you this, I have tried to get through to OLR for at least the past month, and they just don't answer the phone. I mean, I guess they're very busy, you know, but whatever. The phone number that you gave us, and I already called it and you have voicemail. I just want to tell you, I appreciate that, because there seems to be no other way to get through to OLR.
Well, I did, while we were on, I have been talking with, emailing with the director of the employee benefits area, because I do want to find out what's going on there. Obviously, you know, I can talk to a couple of people, but I can't, you know, talk to all 300 of you. And
right. So what Claire had done was give her phone number for one particular person. She really, which was very kind. She really just, you know, as what she just said, she really just can't, you know.
I understand, but
you know,
everyone should be aware that they're not answering the phone. That's all.
I am going to make sure that the phones are being answered. That's a huge problem if that is in fact
Oh,
not
it's true.
happening. There's a
true.
whole call center of people that should be answering the phones.
No,
At
at least not for the past month.
Okay.
Get off
My
the
experience
man.
anyway.
Okay, so you know what? I know that, Diane, you have to get off?
Yes, I do. I apologize, but if there are any
No.
other questions, Marlon's pretty well equipped over there, so he should be able to answer them. But if there's anything that he can't, please feel free to forward them to me.
Diane, thank you very, very much.
Thank you. Thank you,
so much
everyone.
Thank you.
Hello?
Okay, Sherman Gould?
Hello? Oh,
Yes,
who's
yes, this is Sherman Gould speaking. I have a
Yes, go ahead.
question. I have a question about the silver sneakers benefit. If I'm currently a member of a gym, will the program, when Medicare Advantage kicks in, will that pick up the membership that I have now, or
Yeah,
how would that work?
If they're a participating gym with silver sneakers, yeah. So what you would have to do is then cancel your membership and then go through silver sneakers to, have that connected. And then another thing that, since you brought up silver sneakers, is that the gym, let's say you are a snowbird, right? And you do your summers in your city and your winters in Florida, it's portable. So you can go to a gym in New York, and if you're spending a couple months out in Florida, you can use whatever gym participates with silver sneakers there as well.
Okay, but I'm in Florida now, and I go to LA Fitness, which I believe is a member, but they have locations all over the area. Would it have to be specifically one particular gym, or would it be the whole network of gyms?
I would verify always, double check. But LA Fitness, when you say that, they're one of our key participating gyms. They could also always have these nuances, because what I've seen is certain, at least some of the gyms that I've seen have different tiers. So it could be a different tier type of LA Fitness. And if it's not, I'm hoping that they do participate. So just double check with them to see if they are silver.
Okay.
But I would have to wait until January 1st to follow up on that.
Correct.
Okay, thank you very much.
Thank you. Gail Siegel, unmute yourself.
Hi. So I'm sorry, I have a basic question, and I'm not sure I'm understanding it. I'm currently in the GHI senior care program. I'd like to maintain the current coverage that I have. Opt out of Advantage and maintain the current coverage. So I understand that it costs $194.40 to make that happen. But on top of that, what is the $125?
That is the prescription drug plan that is tied to it. But if you either are you currently enrolled in the GHI Express Scripts plan?
Not
as well?
Express Scripts, no. I'm currently enrolled in Aetna.
So if you have an Aetna Silver Scripts, just like I think it was David Chester that had a similar situation. So if you opt out, you'll be paying $194.40 beginning January 1st of 2022, and you can stay in your Aetna Silver Scripts plan.
I can. I don't have to go with the city $125.
You don't. That option was only if you are in the New York City Medicare Advantage Plus plan. You would have to get into a group Part D plan, and that's what one of the options that are being provided.
So just to reiterate what you just said, if I go into the Advantage plan, in addition, I would have to take out the city plan, which is $125.
Yeah, to get coverage, right? You may choose not to have coverage for RX, and then may be subject to a late penalty charge. Or if you have an option of going on to another group Part D plan, then that's another option. And that sometimes is offered whether your spouse may be enrolled in one, so on and so forth.
Okay.
Where is the reimbursement come in? We get reimbursement for Part B. Does that continue?
That will continue.
That does
So,
continue.
yep.
Okay,
Yeah.
and then what was that you mentioned about the union pays $50? What is
I-
that?
I believe that was Bob that mentioned that's one of
Yeah,
your
Bob
union
mentioned that.
benefits.
Yes,
could you-
that remains the same. Okay, Judy, okay. Any other questions?
That's fine.
Yeah, I have a direct question also about David.
Wait. I apologize. I have, again, I'm going down the list here, okay? Judy Ballows, unmute yourself. And I really ask that because it is 2:45 and I really.
Yes, I'm following up. So actually, some of my questions relate to what she just said. So
Right.
the reimbursement for Part B would be if you stay with senior care. Is that correct?
No, that reimbursement of Part B is across all the city plans. So it's
All city
you're
plans.
if you're enrolled in the Aetna plan, if you're enrolled in your
Okay.
you get enrolled is the same.
Now, can
policy.
I still join any of those plans in this year? Do I still have the option of going to Aetna or Humana or any other plan this year?
So you have the opportunity to stay in your plan, but there is, I think the city offers the once in a lifetime change that you can use that now to go into any other plan. But currently
But I
with
can't just use the regular transfer period for now.
The transfer period that is going to be annually and it's going to be for 2022, right?
And
So
if I
it's
go to the Medicare Advantage plan, I must have the Express Scripts. If I want
Yeah,
drug coverage, I can't just pay
Yes.
for my own drugs because I'm very unhappy with Express Scripts. 3 of my medications, I pay over $100 a month out of pocket. Why is the insulin so expensive when other companies, you can get it for $25 or $30 a month, but with Express Scripts, you cannot?
You know what, it's.
Diane ended up leaving and I wouldn't be able to answer
Right.
that, but I know that the benefit is 25% across all tiers. So tier 1, tier 2, tier 3.
Right, but the governor.
Judy, any other questions? Any other questions, Judy?
I guess not for right now.
Okay,
No,
thank you. Ada Riscala.
Yes, thank you for giving me a chance. I would like to figure out, I'm currently with GHI, the senior care plan, and I optioned out from the Advantage plan. My question is how I know that they processed it, because when I went online and applied it, they said that, they will send the proof for receiving the application or processing the application of optioning out by the end of October. But by the end of October, if they didn't, or they claim that they didn't receive it, I'm out of luck.
Yeah, so those are the opt-outs that we have received are being processed, and those who are have decided to opt out, they should be receiving a confirmation letter fairly shortly. Initially, the city was waiting to have all the opt-outs processed so that we can disseminate or mail out those confirmation letters.
Yeah, that's correct. But again, they said that they are going to send it after the end of October. So, for any reason they missed out or there's any mistake took place, how I'm supposed to solve it? It's going to be out of luck.
We will. So when you went on, you did it online or you called in? How did you process it? You went online and you should have received a confirmation
No,
number.
they did not. The answer from them, they said you will receive the proof of processing at the end by mail at the end of October, by the end of October.
And that's the message that was. I will look into this. I took your name down.
Okay, this was for me and for my wife, both of us OSA. Used to be OSA member or still members with you guys, and retiree. My name is Ata, ATA, Apple, Tom Apple, Riscala, R as in Roger, I, Z as in zebra, K as in kite, A as in apple, L as in Lord, L as in Lord, A as in apple, at gmail. That's my name.
Okay,
And my email address
Uh-huh.
ARIZKALLA@gmail.com. That's for me. For my wife, her name is Vivian,
You
VIVIAN.
know what? He can just, oh, I'm sorry, just
She
give her
is
name.
next to
Go
me.
ahead.
She's sitting next to me.
Okay.
No, that and I'll just verify that it that it went through, and I'll have one of our customer service reps reach out.
Okay, would you like to have my phone number?
No, I can email you, or let me email and let me investigate, and I'll get back to you at least via.
Okay, please
email.
verify my wife as well. Is her name is Vivian, VIVIAN. Last name same last name Rizkalla, RIZKALLA, and her email address is vivianrizkalla@gmail.com.
I got it, Mr. Rizkalla. Thank you so much. I'll make sure that we circle back and get in contact with you.
Okay. For any reason, if I would like to switch to any other plan, as far as I just heard from the conversation right now, say it's like, later on I would like to go with Aetna or whatever it is, that will be available for the next, which is next period for 2022, or that's going to be over?
It will not be available. Those plans will not be available for 2022.
Okay, so but I have the right to continue as I am, which with the GHI senior plan and Express Script as a pharmacy.
That is correct, sir.
Okay, thank you so much.
Okay, wonderful. Sheldon Lissacor, unmute yourself.
Yes, I thank you very much. I'm just still confused on this with the drug. So I'm going to try to ask it so that I understand the answer. If I take the Aetna new plan, the new GHI plan that's being offered, the Advantage Care, I cannot opt out of the portion for the drugs and go with an Aetna plan. Is that correct? In other words,
that is correct. So it's only so that Aetna Silver Scripts plan is an individual plan. The federal government doesn't allow the group and individual plans to get married.
Okay, that's one question. Next question is, I just received something, ironically, in the mail from Aetna, and it has a health benefits program application change form. This is not the new Advantage plan, obviously.
Mm-mm.
But why do I have health benefits program from New York City in it? Use people.
That is so are you currently an Aetna member? You're on mute, Sheldon.
I'm currently an Aetna plan only for the drug plan, not anything else. Everything else is through GHI.
I don't know why you would receive a health, and you say that says a health benefits program application form on it?
Yes, with a from Aetna Medicare Advantage.
Aetna's been encouraging people to go into their Medicare Advantage program. There's nothing that we can do to stop them from reaching out to you if they have your contact information.
This is different than the GHI emblem.
Yes, it is a different program.
I also ask this question not just for myself, but for others, because obviously others are going to be receiving this and they're going to see the New York City and they're going to fill it out maybe.
Okay, and actually we have 5 more hands up, and then we are going to,
Yeah, so I'm leading a call at 3 o'clock, Joan, so I would respectfully have to drop off the call.
Yeah, okay. So I'm gonna, if people can really cut to the chase and ask, a question quickly so we can, get as much in before Marlon has to sign off. Michelle? Michelle?
Hi, Michelle McKenzie here. Can you hear me?
Yep,
yes.
Go ahead.
Hi, I think I might have a unique situation. I am the retiree. I am the OSA member. My husband has been on my healthcare plan since we got married. He is older than I am. I am not yet Medicare eligible, not yet. one more year to go. He is already on Medicare. So what do these changes, how do I navigate these changes and make sure that he is still covered? Does he have to take the Medicare Advantage Plus plan? When he is not the employee, he's the benefit. He's kind of like my family plan.
So Michelle, you're currently on the GHI CBP plan?
Exactly.
So if you're currently on the CBP plan, your spouse will be enrolled into the New York City Medicare Advantage Plus plan.
He will, even ahead of me, as far as age.
Yeah, yes, correct. Because
Okay.
he's eligible for the plan.
So what do I do about the prescription writer? Because when we were both out of Medicare, I added the prescription writer. He is the one who takes prescriptions. I don't have to yet, thank God. So what I'm asking is, do I drop the prescription writer because now it's only about me, and he is covered with prescriptions under the Advantage Plus plan, or how does that work?
So your husband is currently on the GHI Senior Care and has prescription with GHI now?
We took the prescription writer and we pay for it in addition. Well, GHI is free, was supposed to be free, but the prescription is what we're paying for.
All right, so he would automatically be migrated into the GHI Express Scripts plan and the New York City Medicare Advantage Plus plan. So he doesn't have to do anything. Now, the cost of that plan is going down. I believe Diane mentioned it was about $150 now. Come January 1, 2022, that same plan is going to be $125. So it's going to go down about $25.
Okay, that's great. And then when I become eligible, which is in a year, do I have to do anything, or am I going to automatically be rolled into this plan?
You'll be automatically enrolled into the New York City Medicare Advantage Plus plan. You're going to age into the plan.
Okay, as soon as I apply for Medicare.
Correct. So you got to make sure you have your Medicare Part A and Medicare Part B.
Got it. And then the Advantage plan will come as part of that plan.
And then you also have to make sure that you submit for your Medicare Part B reimbursement, right? Because it's a benefit.
Oh, okay. He can't do it, but I can do it. Is that it? Because he's not a city employee. I was a city employee.
Well, I think he's Claire, and correct me if I'm wrong here. Her spouse is currently eligible to receive the Medicare Part B reimbursement as well. Yes. So right now, you can submit that on behalf of your husband and should be getting reimbursed for Medicare Part B.
Awesome. Great. Thank you very much.
Thank you. Monty, unmute yourself.
Hi. I have a weird circumstance, I think. So I turned 65 earlier this year. And so I was enrolled in GHI CBP and Original Medicare. And I was also had tertiary coverage from my wife. My wife has a non-city health plan. She herself was receiving Original Medicare, and she had secondary insurance, and her secondary was my tertiary. But in any case, at some point during this year, providers stopped accepting my GHI CPB coverage. And somehow, what happened was my wife's company went to a Medicare Advantage plan. This is a non-city company, American Airlines. My wife's company went to a Medicare Advantage plan, and I got glommed onto her Medicare Advantage. So I'm on her plan, and the providers are,
So what I encourage you to do, Monty, is to look at the benefits, right? Because Medicare Advantage plans are customized for groups.
Right.
So I would look at her benefits and compare them to this plan from the city, and look at, what does it cost? Is she paying anything?
Nothing.
All right, so it's that's the same.
Drugs are included too.
Yeah, and then I would look at, kind of copay structure, so on and so forth, and the network. So you say your providers are not accepting some of this, so that's critical, right? So I would look up your provider, see if they're on part of the plan.
No, what happened is that the providers who worked with GHI are looking onto the Medicare website, and they're seeing that her plan is my coverage now. That's what they're saying. So I call GHI and they say, you're still enrolled, but we're not making payments, because they say that I'm still active on GHI, but they're not making payments because the Medicare website has me as on her plan, her Medicare Advantage plan.
So here's something also to kind of look into, because if you get auto enrolled into the New York City Medicare Advantage Plus Plan, once you're there, you're going to be kicked off of her plan, right? So you have to really, this is where either you opt out or you opt out of the program because you're on your wife's plan, right? So you have to kind of make a decision, look at all your options.
Here's a big thing though. Yep. The Medicare Part B reimbursement, I will lose.
Correct.
That's
if I'm
correct.
not in.
Absolutely.
That's correct.
That's a biggie. So that's more valuable than the drugs, because with the GHI, I'll pay the 125 and get the union reimbursement as compared to the free drugs. But the other way around, I'm going to lose my Medicare Part B reimbursement.
Yeah.
So that's it. So what I started to do, and I'm glad I had this conversation, was I started to disenroll from my wife's plan, because I think once I disenroll, then GHI would become. I would automatically go into original Medicare again. And then GHI would see that I'm no longer being.
You would then be transferred because you are under the senior care plan. So then you will be automatically enrolled into the New York City Medicare Advantage Plus Plan. So, so I would say, make sure that you don't lose coverage, right? So make sure that if you disenroll, you're disenrolling on December 31st. And because you're going to go effective 1/1 onto the New York City Medicare Advantage Plus Plan. So something to note.
To disenroll from her plan, I have to do it now, this month.
Okay.
That's what I was told.
Right.
I wouldn't want you to be without coverage for over a month.
I wouldn't be without coverage. I would automatically, original Medicare would just pick me up right away.
Okay.
So
Marlon, do you have to get off the phone?
Yeah, I do. I'm getting
okay. Thank you for that.
I apologize. I know there was a couple hands up, and Joan and Rob and Helen, please reach out to me with any questions that they may have. I'm more than happy to answer them. All right.
Thank you, Marlon. That's what we'll do. Thank you so very, very much for.
Thank you all for this opportunity. I appreciate it. Thank you so much. And again, as one of the account managers for the plan, we're here to support all the unions and all the members and the city. It's a partnership. Like I said before, we've been partners with the city for a very long time. And, we want to make sure that we take care of our members. So you guys have
Marlon, before you go, can I ask you one quick question? Because it came up repeatedly in the chat, which is on the new plan, are you limited to mail order on drugs, or can you go to retail pharmacies?
So on the RX, yes, you have 90-day retail and mail order is part of the plan, and it's still an open access formulary, so that doesn't change.
Thanks, appreciate it.
Okay,
great. Thank you, Marlon.
Thank you.
Thank you so much. So everyone, there are 4 people with their hands up. I'm gonna call on each one. Give me your questions. I will, if we can answer them, we will. If not, I'll write them down and email Marlon. But we really want, we're gonna wrap this up. So Irene?
Yes.
You're on mute.
I'm a bit confused. You said the Medicare Advantage plan includes drug plan, correct?
No, the drug plan The drug plan is at an additional cost. That's the $125 cost if you take the Medicare Advantage plan.
Okay.
You don't have to take the drug. You don't have to take the drug plan, but you can.
Okay. My other question is that right now I'm a non-Medicare retiree covered under GHI CPB without a drug plan. What I will be 65 in January 2022. Now is my time once I get my Medicare Part A and Part B to contact OLL, which is very hard to get into, and get the form to change my coverage from a non-Medicare retiree coverage to a Medicare retiree coverage. And I want the drug plan. So how do I get that form plus enroll into this new plan? Because I spoke to someone in the rep, they said that I cannot get enrolled into this new Medicare plan.
You'll get enrolled in this new Medicare plan. You'll get information from OLR a couple of months before your 65th birthday, and you'll be able to enroll at that time.
But my 65th birthday is January.
It's January, so you should be getting the information soon.
Oh, okay, because I was told that I was not able to enroll in this Medicare Advantage plan.
You can enroll in it right now, but you'll be able to enroll in it for January.
So in the form that if I go into the OLL site to get the form to change my health coverage to include the prescription drug, would there be an option?
Be able to do that, yes, you'll be able to do that as well.
There will be an option that I could choose Medicare Advantage Plus with the drug plan, correct?
That's correct.
Okay, that's all I need to know. Thank you.
Okay, great. Thank you. Joseph?
Okay, it's unmuted. GHI, senior care, and disabled, and on Medicare. So I believe my drugs are still through GHI, but they treat me with the Medicare rules, which has that donut hole. From what I understand, that the new plan, Medicare Advantage, is 25%. They didn't speak about 25% for the first 2,200 and then 40% until you get to 6,000 and then.
No, there's no donut hole in the plan.
So the new plan, it's always 25.
That's correct. There's no donut hole.
Is there a critical, like, what if you get cancer and you have these drugs that are 12,000 a month and all that? Does that hold true also? After a certain amount, you only pay a smaller, not 25%. You know what I mean?
I think Diane said before that there was a maximum on that. We really need Diane to answer that question. I will follow up with her.
So you believe there's a maximum out of pocket for?
I think she said that. I think she said that earlier.
Yeah.
But I don't want to speak for her.
Now the
Claire,
other thing
Claire,
is,
when you find, excuse me,
the other
Claire, when you find
prescription.
out, you can email me.
Okay.
And then we'll reach out to Joseph.
Okay, under Medicare, I get CGM, that's a glucose monitor, and the insulin pump that I wear. None of that changes, right? In other words, the Medicare Advantage still covers durable medical equipment.
Yes.
Right? Okay. All right. And what happens? Are you in any different legal standing if these cases are won? The cases against the city where you can't do this, like if you stayed in what you had or if you went to the new one, do you think that your legal standing would be the same? They're either going to get rid of the plan or change something. It wouldn't matter that you made the decision to stay or to go to the new plan. I know that's a legal question, but
yeah, I really can't comment on the litigation. We think we did the procurement properly. We think that the city thinks that, we'll prevail in this, but I can't comment on what will happen.
Take out the crystal
All right,
ball. Come on. Okay.
Joseph, I apologize. Joseph,
no, kill it. Yep. Thank you.
Okay. 2 more questions. Susan?
Thank you so much. So I have 2 quick questions. One of them is concerning one of the doctors that I use that I did look up on the site, and I see he's not listed. So suppose, and he's a specialist, by the way. So what happens in the case of a doctor that's not in the plan, moving forward? What do we do on that?
I think Marlon talked before that if the doctor accepts Medicare, they
Okay,
have to accept the payments from the alliance, which are exactly the same as the Medicare payments. And
okay,
their call center will reach out to your doctor to try to arrange with your doctor to take the direct payments.
got it.
And in virtually all the cases, they're successful in doing that.
Even with a specialist?
And in the rare cases where the doctor doesn't want to take payment directly from the alliance, they will send the payment to you and you can pay the doctor.
Okay. Second thing is, the quarterly statements that we get, I was looking it over as far as my deductions. So currently as a single person with GHI, senior care, I see that $100.30 comes out of each check. It says GHI CVP, and then $1 GHI CVP BC, I guess, Blue Cross. So it's $101.30 that comes out of my pension check every month. So if I'm understanding it, it's going to be $125 coming out of my pension check?
No, Susan, the reason it's $100.30 is we reimburse you for $50 per month. So it's actually $150. But OLR is kind enough to arrange the health benefits program to accept our reimbursement directly. So it's reduced to the 100. That going forward would be 75 instead of 125.
And then what about the dollar that?
If you stay in senior care, that will be $2.83, along with $191.57. The 283 is for the 365-day hospital rider, and the 191.57 is the basic plan premium if you stay in senior care.
Oh, if I stay, but if I don't, it'll only be the 125.
It'll only be the 75.
That's correct. Yeah.
Oh,
It'll only
okay.
be 75.
Okay.
Got it.
All right. So, okay.
The
So one
Medicare
last
Advantage Plan includes the 365 days of coverage. You don't have to pay additional for it.
Okay, thank you.
Great. Barbara, this is our last question. Barbara. unmute
Joanne,
yourself.
I also have a question. I was not able to put the hand up, please.
Bob,
This is Barbara.
Barbara.
I think I've been answered. I'm in the GHI senior care, and I'm in Express Scripts. So I will be automatically enrolled into the Medicare Advantage Plan?
Yes, unless you choose to opt out.
Yes.
Okay, but okay, now when my Express Scripts, I pay for it mostly out of pocket, and then I get reimbursed through my union. Through the union, we get a percentage that I get reimbursed every year through 1180. So if I go into this here,
You have a drug plan. You have a drug plan through 1180. Then you don't need to take the drug plan through the $125 drug plan.
oh, so then I don't need to take the 125. Okay.
Joanne, can I ask a question, Joanne, please? My name is Sophia. I was not able to put the hand up there.
Okay, go ahead, Sophia.
Okay, thank you. I just want to say that I'm under the medication on my husband's union. He also worked for the city, but I have a separate insurance complete. I'm asking do I have to do this year Part D for myself, because nobody knows what can happen with my husband and I might lose his medicine, his prescription thing. And can I do it next year if I have to, or any other year, or I have to do it now, the Part D?
Or you can take if you don't take the Part D this year, you could take the Part D next year.
Who's then? Okay, Claire, it's you, right?
Mm-hmm.
Okay,
yes.
Thank you. But how I have to dismiss the Part D if I will have to? I don't have to pay now because we have his insurance for the medicine. prescription? How I go about this to decline that Part D for when I'm moving to the new plan?
You don't have to decline it. You have to sign up for it if you want it.
Oh, I see. Okay, so it doesn't come incomplete. It just I have to sign for D later, right? Before January 1st.
I'm sorry, I'm not following your question. You have to sign.
What do I have to sign to decline?
I'm not following your question, Sophia. I'm sorry.
Okay,
You don't have to sign to decline it. You'll be automatically enrolled just in the Medicare Advantage program. You won't be automatically enrolled in the drug program.
But then I
Yes,
have
you
to pay
will.
$125. And if I
That's
don't have to
wrong.
pay because I have an insurance, so what's gonna happen? I still have to pay those.
But you don't have to pay the you don't have to pay the $125 unless you want the drug program.
No, that's wrong. If you take MA Advantage Plus, you have to take Express Scripts.
You don't have to take you don't have to take Express Scripts. If
That's
you,
not what they
if
say.
You can't choose a different. You can't choose a different Medicare Advantage. You can't choose a different Medicare Advantage Part D program.
That means you have to take
But you
Express Scripts.
can choose not to take it.
No.
Yes, if you're taking a program through the city, you have to take Express Scripts.
I think you're wrong.
Well, I'm sorry we don't have Diane here because she's the expert on the drug program.
And she did say that. Okay, so you know what? We have to, Claire, thank you so much.
Can we have an email for Joanne Borovoy to email questions like you offered other people?
Sure, I'll do, yes. Joan, Joan dot Borovoy, BOROVOY at gmail.com.
Excellent. Thank you so much.
Okay,
and
so
thank you for letting me ask.
If you'll all email your questions to Joan, she can send them on to us and we can figure out who's the best person to answer the question. It may be me, it may be Diane, it may be Marlon.
Okay,
Thank you.
but thank you,
Thank
Joanne, and thank you, Claire, for letting me ask the question.
Okay, thank you, Claire. Thank you very much. That's perfect. That's how we'll do it. Claire, thank you so much for
You're very welcome.
participating in this. We greatly appreciate it. Thank you.
Thanks very much.
Thank you so much. All right, everyone, we are going to
Can I ask?
end the meet. We're gonna end the meeting.
Before you end, Joan
I'm
and
sorry.
Bob, thank you for doing a great moderating job and answering questions as you were able to. So I do appreciate it. I'm sure we all appreciate the time and effort. So moving forward, just want to wish everyone a happy Halloween. Be safe.
Way better than
Thank
the last
you.
one. Way
John?
better than the last meeting.
Well,
Can I ask
there
a
you go.
question?
Yeah.
Joan?
Yeah.
Hi, I was on my husband's health plan and he died earlier this year.
I'm sorry.
Yeah, thank you. So I just recently got finally enrolled in GHI and I'm a senior and I'm a retiree. I didn't realize I wasn't getting any of the mailings from OLR because they probably had my husband's name. So I'm a little bit behind in this whole process. And I just heard right now that if I don't sign up for the drug plan, I won't have one. I didn't realize I had to do that. Is that true?
So what insurance do you have now?
My GHI kicked in.
Your GHI Senior Care.
Yeah, I mean, I was on my husband's, but then when he died, they dropped you immediately.
So you'll automatically, unless you want to opt out, you'll automatically go into the new plan and into the drug plan.
Oh, okay. All right, great.
Right. Okay.
And is there any way to check if I was sent the check for last year's
social, what do you call it? Part B?
Oh, the premium? Oh, I don't know. I got, not, Rob, do you know the answer to that?
You'll have to call health benefits for that. You'll have to call health benefits for that. And I apologize if people are having trouble getting through. I am going to speak to people and find out what's going on. But they will have the answer for you.
All right. Thank you very much. Have a great day, everyone. This was great. Thank you.
All right, wonderful. All right, everyone. Thank you so very much.
See you next month.
We'll
Thank you,
we'll see you next month. Thank you all very much. Take care.
Thank you too. So long now.
Okay. Bye-bye.
Bye.
Bye.